Welcome, welcome, welcome to the 2025 Healthcare for All Oregon Business Meeting and Conference. Thanks for being here. I'm super excited for this day to be here. We've all been highly focused on it at HCAO, at the board and the staff for months now. So it's kind of like the big day has finally arrived, and I think it's going to be a great day because we've got exciting speakers. We've got some great conversations and connections. I'm already seeing some folks connecting and networking, and most importantly, it's a chance to come together with all of you because you all at Healthcare for All Oregon is a membership coalition, membership-driven, membership-led, and all of you are what makes this work possible. So give yourselves a round of a hand for just being here at the annual meeting. Before we get started, my name is Valdez Bravo. I use he, him, his pronouns, and I serve as president of Healthcare for All Oregon. Hopefully you know that already because I'm going to be asking for your vote here in a little bit. Thank you. And before I call the meeting to order, let me just thank our hosts here. So we have the First United Methodist Church, as we mentioned here with Jack. Ocean. Ocean is the EPIC collaborative that helps FQHCs and other healthcare systems stand up and have electronic medical record technology. They're based in Portland. They really started with their roots in Multnomah County. And actually, Mary Lou here, where's Mary Lou? Somewhere here. Mary Lou Hennrich and the Multnomah County Health Department really kind of helped start that collaborative up. And Abby Sears continues to this day, former employee of Mary Lou, but she continues to lead Ocean into the future today. And Kevin over there actually works there too for his day job. But they are expanding all across the nation, electronic medical records and so many systems. And so we are very thankful to Ocean for their support. Also, thank you to the Oregon Nurses Association. Give it up for ONA. We got Jackie from ONA over here. She's our Portland chapter chair. You'll meet Jackie later on this afternoon, but she's also in ONA, so we're really excited for ONA support. Oakshire Brewing, they're down just a little bit down the road here, but they're a brewery, and they have a social justice mindset, and so they contributed some prizes, and that's what that raffle ticket is going to be for. So if you win the raffle ticket, you want to keep the t-shirt, but give the beer to a friend, because that's not your style. That's cool, too. But we'll be doing a raffle pool later. And then Project Access Now. Project Access Now, if you're not aware, is a nonprofit based out of Portland. And, we're all fighting for healthcare for all, right? And the Universal Health Plan Governance Board and a universal health plan that would cover everybody. But in the meantime, we're stuck with the system that we're stuck with right now. And there's a lot of people, despite having OHP and other kinds of coverage, they can't obviously afford or get the care that they need. And so what Project Access Now does is kind of almost like health scholarships to help fund them getting appointments. So if there's somebody who's on OHP, but they can't afford the referral or get the specialty care because it's not, they will help step in and make sure that they get that care, and they do a variety of other wraparound supports too. We were very honored to be invited at table at Healthcare for Oregon to their gala last month. I had the actual opportunity to MC that. It was really fun. And so we're very thankful that they're a sponsor of Healthcare for Oregon. So although we're fighting for the transformational solution that won't need these kind of Band-Aid approaches, we're very thankful for the folks that bridge the gaps in care. So give it up for Project Access Now. All right, so gaveling the meeting to order. The 2025 business meeting, HCAO. As you all know, we really are doing on the leading edge of things here in Oregon in terms of the work we're doing with universal healthcare. As you all may or may not know, HCAO has been around for 25 years. I was talking to our founder here and historian and our secretary, who wears a lot of hats, Mark Lindgren here, about, give it for Mark! I'm going to stand on the shoulders of greatness. He was telling me, he was giving me some education where I think it was the spring of, was it 99 or 2000? I think spring of 2000.
Spring of 1999, we established a steering committee.
Oh yeah, say that again.
We established a steering committee in spring of 1999.
Spring of 99, and then you all voted to actually, was it 2000?
2000 was the official incorporation.
Okay, official incorporation happened later, but it started in 99.
And then there was state incorporation, followed by IRS.
Followed by IRS. So the way I've been thinking about this is, with the Affordable Care Act, you can be on your parents' plan until you're 26, and then you got to figure something out. So we're about to age out of our plan because we're 25 years old. So let's get a new plan. Let's build it ourselves and get on our new plan. But we've been doing this work for all that time, and because of the work that many of you in this room started, and that a lot of us have joined the fight to help finish and carry forward, we are really at the tipping point of, we're the bleeding edge of healthcare in America when it comes to the universal healthcare movement. And as you all know, sometimes big things happen in one state, and then they happen in other states, whether it was medical marijuana, death with dignity, gay marriage. What's that?
Bottle bill.
Bottle bill. Hey, look at the bottle bill. Actually, they're tweaking that puppy right now. But anyway, sometimes things happen in one state, and then the other states look at. Nobody wants to go first. Sometimes it's kind of scary to go first, you know. But if you think about the diffusion of innovation theory, which says that like 1.5% of the population are like usually your early adopters, and then there's another like 7.5% that are like your early majority, you know? Think about the first person you know that bought an iPhone, you know? I resisted at first. Or a Prius, right. There's all these new type of things that sometimes we don't want to be the first one to go on. And shaking up the whole healthcare system can be like that. So, but the thing is, and I think you're going to hear about more today, what used to seem radical, and the only 1.5% maybe were with us here in the U.S., even though they've kind of had this figured out for years in other countries. We're now starting to, I'm feeling it's more like an early majority. I'm going out to places, you're going to hear about some of our victories and celebrations of our growth here in a little bit. But it's starting to become more of a recognizable name. I bump into people and they say, oh, I know, I've seen that guy on TikTok, that Collin Stackhouse guy, talking about healthcare for all Oregon. So we're starting to get more recognition, more awareness of the work. Legislators coming to us to ask for our support or to look at their bills, to weigh in on it, to see if it's something that we think is a good idea. The Universal Health Plan Governance Board. So there's all these reasons which show we're moving into early majority standpoint. And then Nick Campbell, say hi to Nick Campbell over here, the chair of the new Central Oregon chapter in Bend. They had their chapter kicked off. He did a press release. The news picked it up, and it became what I think has been like the best commercial for HCAO there ever is, featuring interviews with Nick, and the reporters talk, basically saying the words that come out of our mouths. And that was seen by a whole lot of new people that probably hadn't heard of us before. So that's the kind of stuff that we're going to be continuing doing, building on the momentum of the National Single Payer Day rally that we'll talk about in a bit, to really move us forward. So Oregon, we hope to be the first, and with all your help, we'll make it first, and then hopefully other states will follow. All right, let's see the next slide there, Collin. Okay, opening remarks. Oh, too late, I already did it. Yeah, go ahead, Tom.
Establish a quorum. Do we have a quorum?
Okay, let's go to the next slide there. Oh yeah, don't worry. Okay, all right, Linda, did we have at least 13 voting members register for quorum? Is that Robin? Robin, we're good?
Yep.
All right, we have quorum, so you can get those hard numbers from Robin there, Mark, for the record. But we have quorum, so we have we're a membership organization, so it requires a certain amount of you. Raise your hand if you were a voting delegate for one of your membership groups here. Look at this around here. So we've got chapters, we've got other groups here. So thank you for carrying your vote forward for your folks in the chapter. So the key parts we do during the business session before we go to the conference programming session that'll begin at 11, with some opening remarks by State Representative Lisa Fragala, is that we have a chance to give you all an update from the financial picture, because one of the duties of the board is fiduciary responsibility and make sure that this movement is a going concern, at least from an HCO standpoint. And then we'll talk and we'll do the elections. So without further ado, let me go to the next slide. All right, so without further ado, I'm going to invite Kevin Geoffroy up. Give it up for Kevin, our HCO treasurer. All right, Kevin.
Thank you,
Financial
Valdez.
report.
And where should I stand? Near this one? Just talk? All right. Hi, everyone. My name is Kevin. I'm here to give you a brief financial update and report on HCAO. If you go to the next slide.
Make sure to speak into the mic so
All
they
right.
can hear you.
I will. And if you go to the next slide, I'm actually going to skip it. Start here. I want to start with the key takeaways. The first thing I want to say is that we're stable. Last year, you may remember, when we gave this report, we were operating at quite a deficit. That was a significant issue to the organization. The board looked at it. We spent several months. We looked at our expenses. We looked at our contracts. We looked at where we could cut back. And we did all that, and after all is said and done, as you know, we had to part ways with our executive director. It was a really difficult decision, but it was the right thing for the organization, and we're now stable. It was pretty difficult. If you can indulge me for 1 second, a lot of people sort of stepped into it because to operate without an executive director is hard. It takes a lot to operate this nonprofit. A lot of people stepped up, from staff, volunteers, the board. I just want to call out Valdez. I don't know where he disappeared to, but he particularly impressed us through this process. Sort of stepping in, managing the operation, and making everything successful. So, even now, you can see him working on something. We had a strong end-of-year appeal. We ended the year with almost $110,000 in cash assets. That's about 5 months of cash. So we ended the year strong, thank goodness. And when we established our budget for this current year, we were more conservative. We looked at what we actually did in 2024 and sort of used that as a starting point. We wanted to make sure that we would stay a going concern and operate well within our means. We are, in fact, dependent on one major donor. They continue to donate to this organization, which is wonderful, but we are looking to diversify. We're doing that through trying to gain those sustainers, more corporate members. We're working with other potential funders and donors and foundations, et cetera. And to do that, we've invested in member outreach. Many thanks to Robin Gottlieb, who we just saw. She's done a tremendous amount of work sort of increasing our sustainers. We've all seen our social media jump leaps and bounds this year, gaining new followers, raising the voice of this organization. Many thanks to Collin for all his work there. And we've invested in database. We spent a lot of time on the one that we've got. We're working on developing an even newer one. These investments, as Valdez was saying earlier, are starting to pay off. So anyways, we're stable, and we're in a very different place than we were this year at this time. If you go back one slide, this is last year's budget and our actuals. You can see that our revenue is down from what we had anticipated. Through the course of the year, we had to look at expenses, so we brought those in line. We did lose money over the course of the year, a little bit more than we anticipated, but I think we made all the right changes that we needed to continue this fight.
Good.
Any questions? All right, I'll turn it back over to Valdez.
What were some of the biggest changes made?
What were the biggest changes made? Quite honestly, I think the biggest change to this organization was the loss of our ED. And that was really difficult for the organization. She was wonderful. It was just something we had to do.
I think there's been an amazing outreach to new volunteers who have stepped up to take on roles that in other organizations staff would be doing. I mean, they're spending a lot of time, and some of them were giving a little stipend here and there, but I think that that's part of it, is that we really recruited some new, younger people that have a lot of energy and belief in this, and they're putting their money where their mouth is. They are out there doing it. I think Collin's a great example. I mean, if you watch TikTok, which I don't, but I see him show up on Facebook, and he's out chatting, telling people what's going on. And we're hearing and getting new volunteers that are coming, just kind of with the time. I think what Valdez was talking about is really helping how it is now, and that people are, it's not like a, what are you talking about? It's like, we need that. And so in that effort to capture those people and get them, we have HCAO 101, so people can learn. So there's a lot of stuff that's gone on, and I think that, and you're right, Valdez, and I think Tony Germann is another one who has put a tremendous amount of effort and time. So I thank you.
Okay, so next up, financial report. Election of the officers. So if we go to the next slide. So we're going to have officer elections. So first we're going to do the officer elections. Oh wait, sorry, go back one. Wrong. Re-election of at-large board members, the election of the new nominees, and then our nominations and elections committee members. So we will try to move through this expeditiously. None of these positions are contested, so that helps a little bit. But let's go to the next one, and if I could have Mark and Tony kind of come up here. And if you all could just maybe take 1 minute to just say some remarks, and I'll go first. My name is Valdez Bravo, as you all know. I am running for re-election of President of Healthcare for Oregon. We have had conversations within on the board and our Nominations Elections Committee about the need to maybe change it up, or is there anyone out there that's raising their hand saying, I want to be president? But we didn't have anyone kind of like that. And so I'm running uncontested for re-election for president, and I humbly ask for your vote. And I'll give it to, we'll vote on all these at once. So, yeah.
I'm probably the only one here who doesn't know what FACHE means.
Oh, sorry.
I don't know.
Sorry, FACHE is, so outside of Healthcare for Oregon, so my day job is I'm Deputy Director at the Multnomah County Health Department, and I'm a healthcare administrator by day, and there's a professional society called the American College of Healthcare Executives, and it's a professional society, so I hold board certification as a healthcare executive, so that's what the FACH is. That's a good point. Yeah, it also means angry in French, but I try not to do that.
As you guys all know, Valdez's first job is this right here, as evidenced by this year, and a remarkable job, just to call out Mary Lou. Okay, we'll eat this mic. So again, just to call out to my friend next to me, how much he has done for this organization this last year, tremendous. So a huge round of applause for him. My first job is actually this. My second job is I'm a family physician. So I'm Tony Germann, Vice President of Healthcare for Oregon. Been entirely proud to serve you, and I look forward to that work. Hopefully you get your vote today. If you don't, that's all good. I'll just go back to my day job. But I'm really excited the work that we're doing and how we pivoted this last year, and really creative, positive solutions that I think are, we're going to talk a lot about today. Some really great returns on some of the things we've done and changes. And I'm really excited. Because my other roles is I work at the state. I sit as the vice chair for the Oregon Health Policy Board. Be stepping into chair next year. Thank you. Seeing in front of us what we have coming with this budget reconciliation for Medicaid, and many of you are paying attention to that. I'd love to chat to you more about that. But now is the time. Now is the time for everybody to work in here for us to do what we're doing. And so I'll pass it over to Mark.
Give it up for Tony. Typo on the screen. Mark is running for secretary, not treasurer. I think I had a Freudian slip because I think of Mark is a treasurer, but he's running for secretary.
Refused to serve as treasurer. Thanks, Kevin. I've been involved since 1998. I chaired our ballot measure in 2002 that got badly spanked, but off we go. I'm more of a soup to nuts guy. I'm the secretary. It's a job that suits me well because that's what I do professionally down in Corvallis, working for the city, taking minutes. I'm excited as we move forward for the replacement database that we're getting installed that should help us be able to train our volunteers much more quickly. And they have a particularly good advocacy email system that I'm so excited about. Anyway, I'm so happy to see you all here and continuing the work, so thanks.
All right, so the board actually nominates the candidate, so it's already kind of on the table in the agenda. So if I could pull out your green cards, if you're a voting member, and hold them in the air if you are voting yes for this slate of officer candidates. All right. Yeah, red card is only if you kick somebody. All right, okay, thank you so much. And any red cards? Anyone voting no for this?
There should be a count.
I think it's acclamation if we don't see any red cards.
I think you need a count.
Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22 green cards. Sorry, 22 in favor of the slate. All those opposed, please hold up your red card. All right, you're opposed. All right, it's close vote. This is like Chicago stuff here. Okay, no, more like, no, I won't say it. Any abstentions? All right, your officers are reelected. Congratulations. All right, next slide. All right, we have some folks running for reelection. So Mary Lou, if you could come up. And I will say that Kate is not able to be here today. I don't even think she's on Zoom just because she has a very serious family emergency going on. And then Hayden is at a wedding of a good friend, so that's why he's not here. So I can tell more about them, but if you'd like to introduce yourself.
I'm Mary Lou Hennrich, and I've been on the board for 5 or 6 years, 7 years, I can't remember now. Tom Sinsick can probably tell me. But anyway, I started out as a public health nurse. That's what I am underneath it all, is I'm a public health nurse. I have been a deputy director at Multnomah County Health Department. I've been I started Care Oregon, for better or worse. A variety of things around the healthcare system. And I wasn't always here saying we just needed to start from scratch, but I'm here now. I have been in too many places. And so, no, I mean, my kind of thing I've been saying to Valdez is no more Band-Aids. We need to transform the system. We need to really build something new. And there are many Band-Aid organizations trying their darndest. I mean, people out there doing good and putting their hearts into it, but it just can't go on. And we have got to come to that realization. I've come to it. And so I'll be talking later, I got myself appointed to the Universal Health Plan Governing Board. And I do try to kind of, I mean, today I'm going to be talking wearing my t-shirt, but I do try to kind of say, this is my advocacy part, and this is my governing board planning part. And that trying to keep them somewhat separate. And at first I was a little worried about, could I do both things? But most of the people on the governing board actually work for somebody else. At least I'm not working and being paid by anybody else. I'm, entrenched in this. But I do think everybody on the board is trying to kind of set aside wherever their day job is and to really focus on how we develop the new system. So that's what I do. I'm pretty passionate. I try to help out where I can, and I made some brownies for this afternoon, so, all right.
All right, brownie points for Mary Lou. All right, also up on this slate is Kate Feaster-Minogue, who lives out in LeGrand, Union County, and leads our mobilization committee. She's a nurse educator. Hey, Union County, we got Randy Knopp over here from Union County, holding it down. Eastern Oregon represent. And so she's a nurse educator and has been working with the chapters to grow the chapters and support them and make sure. So these cool little cards that you got, she worked with the chapters to design those. And there's new chapters standing up that we'll tell you about. So really excited for Kate coming back. And then Hayden Rook-Lay, this is his first time up for re-election. So he's been with us for about, I guess 2 years now. So this is moving into a second term because we have two-year terms. Half the board 1 year, half the board the other year. And so he is a health policy advocate, expert, graduated from Stanford with his JD a couple years ago, but unlike a lot of people, didn't go running to the investing firms and the brokerages and stuff to try to make as much money as he humanly could, but he's putting his knowledge and know-how to helping craft, draft, advance good health policy, like the recently signed out of the House Corporate Practice of Medicine Doctrine. Woo! Senate Bill 951. So Hayden is it's too bad he can't be here because of the wedding, because he is a local guy. He grew up here in Eugene, so one of Eugene's hometown heroes. So without further ado, I'm going to put this question for our re-election of at-large candidates. So please hold your green cards up, and I will do the count. All right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24. I think I have 24. 25. Where is 25? Fritz. Yes. Hey, yeah, I did get you. Good to see you. It's been a minute. All right, 25 votes for the in favor. Are there any opposed? All right, not seeing any abstentions. All right, please help me celebrate the re-election of our 3 at-large board members. Okay, so we're adding some new board members, if you will have them, if you vote for them. Some new board members. So Shannon, if you'd like to come up, Nick, if you'd like to come up. We've got 4 board members that we're adding. Now 2 had some, there's again, life happens, especially right now, there's a lot of life happening. So 2 were unable to make it, but I think they might be on Zoom. But I think I'm just gonna stick to the in the room presence because the Zoom is scaring me a little right now. But we have 4 members, so I'll let our in-person nominees introduce themselves, and I can tell you a little bit about our other 2 nominees. So first up, Shannon Saldivar.
My name's Shannon Saldivar. I'm from the Dalles, Oregon. I lived there my whole life. I own a small health insurance agency. I get to see firsthand every day in my work how lack of access, as well as just the complicated, fragmented nature of our health insurance industry impacts people in our community. I'm extremely passionate about helping folks advocate for those things, as well as working towards universal health care. I'm extremely honored to be part of Healthcare for All Oregon, hopefully. And I appreciate the time and being able to be here. I also have 2 daughters. I'm a mom. One's a teacher and one's a student, so it keeps me busy, but I love volunteering, and I'm extremely excited to be, hopefully, again, part of this board. So thank you.
Awesome. Thank you, Shannon and Nick. Come on over, and you're really gonna like eat the mic. Pretend like it's an ice cream cone, but don't lick it.
All right, I will hold it very, very close to my mouth. And my name is Nick Walden Poublon, and I don't want to bore you with my story right now because I'm going to talk a little bit later specifically about how it is that I became activated. But I did spend 10 years as the student health advisor at Portland State University, where it was my job to make sure that our healthcare policy and our trans healthcare policy in particular worked for students. And I'll talk a little bit about my personal life and being diagnosed with a brain tumor at 27, my first week of grad school, and what that was like and how that changed my life. And I think that there's sometimes we need to have people at the table who have, quite frankly, been on the table. And I'm one of those people. And so I'm not a doctor, I'm not a nurse, but I'm here as a patient and someone who then got involved in healthcare policy as a result of that.
Where do you live?
Oh, and I live in Sandy, Oregon. I live in Sandy, Oregon, and I'm the former Democratic nominee for House District 52. Yeah.
Nick Walden Poublon. All right, now we also have 2 other board members, again, who are, I think, probably dialing in remotely.
Okay, my name is Belinda Beltran, and I was born and raised in Portland, Oregon. And my, and my profession that I chose was to work for the insurance companies. I started off working with Aetna Medicare, helping the elderly, processing medical bills, reviewing them, making sure that denials was correct or incorrect. I would correct all of the billings. And I worked for Blue Cross Blue Shield of Oregon, same role where I worked in the appeals department, reviewing, processing. I worked with the coding the claims, and it was just a lot of new knowledge that I learned over the years, and I processed claims and reviewed claims for over 40 years. I started in 1975 before the computers. We processed by hand, but I learned how to do it on the computers, and I worked until 2015 in the medical claims billing departments. And I've learned a lot, and I volunteer with the Donate Life Northwest program. I've served on the board of directors for Donate Life Northwest for 7 years. During the COVID, that's when I decided that I needed to get a break, have a break. And so now I am working on a nonprofit where we deal with mental illness, child molestation, and domestic violence. And I'm willing and I'm happy to volunteer with the organization to help with the medical problems that they have with the claims and denials and all this. And I understand how important it is for our customers to be able to get their claims paid in a matter where they don't have to appeal. They're not getting denied. Because I had read after I was no longer with Blue Cross Blue Shield, a lot of the claims were being denied as not medically necessary. And there was a class action lawsuit because they were being denied incorrectly. And so they had to pay all those claims that they had denied as not medically necessary. And that was one of my responsibilities, is to make sure the claims that was denied correctly, and the ones that wasn't, I would reprocess them and get those bills paid. So I'm glad to be here today.
And where do you hang your hat there, Belinda?
Where do I hang my hat?
You grew up in Portland, right?
Yeah, I grew up in Portland, but I live in Vancouver, Washington.
Yeah. Awesome. Thank you, Belinda. Give it up for Belinda. You're getting a lot of love in the room here, Belinda.
Thank you. I appreciate you.
Denise Peterson is our fourth and final candidate at large new nominee. Denise is an elected member of the Multnomah Education Service District. She is she's a former union member at PCC, worked at Portland Community College. That's where I first met her. She's also very active within the community, is a faith leader in Portland. And also, speaking of faith in Portland, if any of you are familiar with Bernie Foster's The Scanner News in Portland, every year they have their big Martin Luther King breakfast in January. And I know that Mary Lou attended that, I think, last year during the winter storm and still made it. Denise organizes that. That's like her big event that she's like responsible for bringing together. So Denise is very talented, very experienced, very heartfelt on this issue. Also is very interested in intersections with wellness and integrated health in the universal healthcare movement. And again, as a faith leader who we're trying to connect more with the faith communities. And so I'm really excited about the candidacy of Denise Peterson. All right, so I'm going to go ahead and move this one to a vote. So if you are voting for this slate of new nominees to serve on the board, please raise your green cards up, and I will do the count. And I'm going to start to the left here with Rick. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. 25 votes in favor for the candidates. Any no votes? Looking for any no votes. I'm not seeing any abstentions. All right, congratulations, Shannon, Nick, Denise, Belinda. You have been elected to the Healthcare for All Board.
All right, thank you very much.
Thank you for stepping up. All right, what you want? Randy, would you please come on up? And Keith Tierney. Keith, are you here? I don't know if I saw Keith yet. Randy, we'll bring Randy up. So the way that these folks get to be on our radar, he's coming. Okay. In terms of interest for serving on the board, is there's a nominations and elections committee, as Wes likes to say, the most important of all the committees, because they really determine who gets on the bus, so to speak. So we have connections. We look for geographic representation of lived experience, people to be at the table who've been on the table. I'm going to steal that line from now on, Nick. And we have a maximum per our bylaws. We can have 19 board members. And so we try to, have not too many, but not too few. We like to leave a little bit of wiggle room because there's always a possibility for appointing a board member in between these meetings. But this is the only meeting where we do the elections. And so I'm joined here by Randy. So there's 3 elected nominations and elections that you all elect. That's who you're voting on now. And then 2 board members help out. So I've been helping out with the nominations election from the board, as well as Vinny Blanco. But in person today we have Randy. So Randy, would you like to share some words about yourself and why you're willing to serve on the nominations and elections committee again?
Well, obviously, I think my heart is in the same place as everyone else.
Tickle the good tea.
Really?
Yeah.
Is that better? Yeah. Raise your hands if that's right. Yeah. And I am a person to rules and procedures. Rules and procedures matter to me. So oftentimes what happens in large meetings like this, and large means you are successful. You brought together so many people from diversified communities. people of interest in the care and welfare of others. And my job in seeking out candidates was, the first go-around was shepherded by Valdez, who has many more connections than I do. But that said, bringing in your geographic partners throughout Oregon, both in southern and in particular the eastern counties, is critically important going forward to your political will. And so I see my job on behalf of HCAO to continue in advocating for eastern counties, to their greater participation politically, and to electing a congressman who will represent our values.
Thank you, Randy. All right, our two other nominees are Keith Tierney, who lives in the Mid-Valley HCAA catchment area. He's a retired lawyer who does, like Hayden, brings those legal skills for good, working within our movement. And he has been, so we elect 3 members, and then one of them is appointed to lead the crew. And so Keith has been the one chairing our nominations and elections committee. So Keith is willing to serve again, and he helped make initial conversations to Denise and to Belinda and to Shannon and to Nick, and to have that conversation, because we try to have some checks and balances here. Otherwise it could just be, hey, Valdez met this that guy and thinks he should be on the board. And then, no, it's like, it's very much due diligence of like identifying people, starting conversations, the group discusses it, and then the chair will have some vetting conversations with the people. So, okay, I just want to explain that. All right, we also have Jessica Guernsey. Jessica Guernsey is a colleague of mine at the Multnomah County Health Department. Jessica is our former public health director of public health, who led Multnomah County through the bulk of the COVID pandemic. She had recently stepped away, but is actually kind of coming back. I always like to joke, you can leave, you can stop working at Multnomah County, but you can never leave. But she's back and working with us again, which we're really excited about. But Jessica is people who knows people as well. There was a flavored tobacco ban passed in Multnomah County. It's gone through the courts and been passing some tests and whatnot. Jessica and her team worked with communities, particularly communities of color, to really get the buy-in and to marshal people to come and provide testimony, and to do that because it was very novel. Washington County did one right around the same time, but a flavored tobacco ban, which was pretty historic and a very much upstream intervention to keeping more people healthy. And so Jessica knows all about the work that we try to do in terms of like coalition building, and I think she's going to be a really great person as we think about who could be joining the board as somebody that knows people that could get involved, and really I think also help diversify our coalition in doing that as well. So without further ado, I'm going to put this one to a vote. So a slate of 3 nominations and elections committee members. If you could raise your green card and I'll do the count. All right, so we got over here with Rick. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25 in favor. All right, any opposed? Looking once. I see red shirts, but no red cards. All right, any abstentions? All right, congratulations to Keith, Randy, and Jessica for being elected to the Nominations and Elections Committee. Oh, and Jessica was very apologetic that she couldn't be here, but those of you who do know Multnomah County, we're doing a bunch of budget stuff, and it isn't restricted to the daytime hours. Okay, all right, You Rock Awards. Now, Tony, I'd like to invite Tony, who I see is meeting with a very special someone who you're going to be hearing from very shortly. But we're going to give our You Rock Awards, and before we do this, though, this is an annual tradition where we honor just some awesome rock star volunteers with a You Rock Award, a very coveted award. Raise your hand in here if you've ever received a You Rock Award during your many years with HCAO, huh? You see some former award winners here. It's like right up there with the Kennedy honors, I think, maybe even better these days. But anyway, Tony, I think we were talking about earlier how, although there's going to be several award winners here as we conclude our presentation, everyone in this room rocks. There's so many people that are rocking and rolling, and this movement is. And I know we're just going to share a few bit of our highlights with you, and I'm going to go to Tony first while I get my rocks.
Yeah, we have a lot to celebrate.
And we just thought, you know, we're going to call out a few very special people. But again, this work gets done by every single contributor in this room and across this state in our membership. And we're just really thankful for that. But we thought we'd just call out a few folks and celebrate some of the work that's been going on. Valdez, you were going to bring up a little bit about our new chapters. Do you want to just call that out?
So really excited for, like, we've had the chapters we have, and it's been kind of the chapters we have for a while now. It's been kind of not a lot of new chapters popping up. But just since this past fall, we have had new chapters popping up, almost like Kate Feaster-Minogue, our mobilization chair, is there to kind of coach them and receive them and help identify them, but they're almost on their own. And there's several examples of that. First, I want to go to Nick Campbell. Nick, stand up. Nick, wave your hand up. Nick found us. I think he found us, or I don't know if we found you, Nick, but we found each other. And as soon as I saw the name, I was excited because Cheryl and Brian Campbell in Union County are so awesome. So any Campbell is cool in my book. It's the right thing to do. But anyway, so Nick is in Deschutes and just started up the Central Oregon chapter. So now we have a chapter present in Bend. Bruce Deloria. Bruce, could you stand up? Bruce Deloria found us, has been a longtime activist, but decided that we needed a Healthcare for All Oregon presence in Tillamook. So give it for our new chapter in Tillamook. Another new person, Shalana Connors. She's out in Astoria, and she's a mental health counselor. And one of her patients, I think, flipped the script and started telling her about some prescriptions for change and said, you need to get involved with Healthcare for All Oregon, and started up what is now the Clatsop County chapter. And Shalana, if you're dialed in, thank you so much. I was finding a table with you at AFT a couple weeks ago. And then we also have a new person who I haven't yet met down in Coos County. And so Kate is talking to that person, and we'll probably get a chance to meet them in person, maybe at the garden party at one of our next meetings. But and then I think we're also talking to someone in Douglas County right now, or is that one's still kind of in the conceptual phase? But if you know an activist who is out in a county where we're not like incorporated yet, where we don't have a chapter, doesn't mean that we can't start one, as Nick, Bruce, and Shalana have demonstrated. So thank you to our new chapter leaders.
Yeah, give it up. I got to spend time with Nick actually 2 weekends ago, and just the great work that's going out there. We were out on corners with signs and hollering, doing it all, and the good work, and it's done by people in this room. I want to celebrate actually 2 of our newer staff members. I feel like they've been here a long time, but are really revolutionizing what we're doing. We mentioned this was a very hard year. It was a really hard last summer to make some tough decisions as a board, but we made decisions, and then we pivoted, and we changed directions in a way that we had to adapt, and I think we're better for it. We're learning, we're figuring out how to do things better. I want to call out Collin, and I want to call out Robin Gottlieb, who both. Yeah, keep it coming. And we need to celebrate our wins. We are growing faster than we ever have in this organization. And I was talking to Linda and looking at some of the data we've had and thinking about we're moving into a new database. And we're having a problem where we're having too many people in the database that we have to expand it. We've had 4,000 signups in the last 6 months. And just to put that in relevance, we had about 38,000, right? So that's a 10% growth, right? Just in the last 6 months, in thinking how we're doing things differently and how we're trying to adapt and create new opportunities for this organization. So a big call out to that.
Another thing is just I feel like we've just got such great relationships with the legislature, and we'll talk a little bit more with some of our legislators here in a minute, and then also later on this afternoon. But really feeling like they are out there on the front lines trying to solve problems in their community today. And you all are very much, many of you are not only advocates, but policy experts and have those relationships in your community, maybe in some of their districts. And so we're really enjoying the partnership and collaboration and problem solving and working together to champion good legislation that's going to help fix the system now until we can get to the system of tomorrow. And so I feel like we're just really seeing a lot of good stuff happen in Salem. And a big part of that was, and we'll probably hear from this with our next speaker, but the corporate practice of medicine doctrine, SB 951, it passed out of the House. I think it's just waiting on the governor's signature, but that's going to really weaken corporatization's hold on healthcare. It's going to end those non-competes that have seen so many providers here with like the OMG, being not able to practice in their own backyard. So it's resulting in kind of a physician-provider brain drain when people can't compete just because they leave the one place. And it just strengthens that relationship between a physician and their patient wholly. And so we're really excited about that and the legislative partnerships that we have.
Yeah, I mean, I think just we were talking over the last couple of weeks of building strong relationships. And we're going to have actually a session later today in the conference about coalition building, which we have been very strong with. But it is really remarkable how many more stronger relationships we're having. Also the outreach with our legislature and the relationships that are personal, that we're creating broader connection because we're working with them on our fundamental principle of single-payer, universal health care, but understanding there are steps that we're taking and being instrumental in getting good, sound policy. And Senate Bill 951 is a perfect example of it. There are some other specific pieces of legislation that the legislative committee, if anybody has interest in that, come talk to me. Hayden is doing a phenomenal job on that as the chair of that committee. But I would say a number of great wins with specific relationship building with our legislators, but also, again, with the coalition. So just a really exciting time period that we're having right now.
And as we wrap up and move into the individual You Rock Awards and transition to the conference segment of the program, again, I just want to thank all of you because whether it's what the work you're doing in the social media communication space, I mean, if I had $1 for every time someone said, oh, I know HCAO from Collin, I don't even recognize him unless he's walking down the street talking about the governance board. I mean, it's kind of weird to see him sitting still. Or having conversation in these chapters, or these big single payer rallies we had just this last weekend. Mid-Valley, and I think Eugene, you sent maybe some of your folks up to Corvallis, but Mid-Valley Healthcare Advocates staged a great rally in Corvallis. And I love Sarah Finger McDonald, State Representative Sarah Finger McDonald's quote. Yeah, give it up for Representative Finger McDonald. No family should have an economic crisis at the same time as they're experiencing a health crisis. I think that just is like the name of the game right there. But not only did we have that awesome rally in Corvallis, but Tillamook, our new Tillamook chapter had a small rally. And it was the first, which was important to have the first, but also Bruce had a few retired docs from Adventist come over and want to get involved. So now he's got like a HEBO, chapter captain and all kinds of stuff going on. And then also in Medford, there was a Jackson County Health Fair, and Lori Hoagland and the Rogue Valley chapter went to the chapter and engaged with a bunch of public health professionals who Lori says are really fired up about the work we're doing, and a lot of them didn't know about it yet. So it's just a reminder that we need to get really be plugging into the public health space, because when you talk about upstream prevention, I can't think of more of a transformational approach to battle health inequities by 2030 than a universal health plan. Also, Bend, Nick had a Bend rally last Saturday out there, and the Oregon Academy of Family Physicians was in town, so Tony and Dr. Bruno, they got a chance to go out there. And then, of course, Portland, we had the Portland rally. And just give it up for our Portland chapter chair, Jackie Naganua. And we've had a Portland chapter, but it's in a real explosive growth mode right now. It's like riding this wave of all the interest and stuff that's coming in. So Portland had a great rally. We had elected representatives from the city, state. Travis Nelson, our good friend, State Rep Travis Nelson, was there. And Norman Sylvester played the Healing the Healthcare Blues on stage. It was a fantastic rally. So you all made that happen. There were over 30 cities raising and elevating single-payer awareness on that day of action last Saturday, but 5 of them are right here in Oregon. So give it up for yourselves. You rock! All right, so speaking of You Rock Awards, we're going to do these You Rock Awards, and then we're going to pivot to our conference portion. And the first You Rock, these are very fancy, very highly coveted. This is like that Fabergé egg almost. But the first name I want to recognize is just a You Rock Award winner is Jackie Naganuma. Come on up, Jackie. Jackie is an ONA bedside nurse by day. She also holds elected office within her local ONA union. They're at the FRA of Milwaukee, and has just been doing amazing things, whether it's devising HCAO 101 and orientation for new volunteers, or getting the Portland chapter, doing social events and all kinds of stuff. You're rocking and rolling. So Jackie, you want to say a few quick words?
Sure. I don't know what to say because I wasn't prepared to give a speech, but I got involved with HCAO actually because I read a Bernie PDX email, which Robin's in charge of, so it's a crazy connection. I think that I was pretty depressed about all the politics going on in the world, but then I found this and I'm like, oh, hey, this is something I can put my all into, and this is something we can actually achieve, so. And that's all I got for you. Thanks.
Jackie, can you hang out here? Because I'm going to take a picture of all the UROC award winners. Another one of our new chapter leaders who we just wanted to celebrate and acknowledge because he's done so much in so little time is Nick Campbell. So Nick, please come on up. Nick is well, I don't really exactly know how to describe what you do by day with the lever, but if you want to say a few words, Nick. Thank you so much for all you're doing out there in Central Oregon.
Thank you all, and I'm just very excited and honored to have been welcomed into this this organization so quickly. Sorry, yeah. This is an issue I've cared about deeply for a very long time, and like many people, I've been deeply saddened by the state of our politics. Similarly to what you just said, this is an issue that I've always cared deeply about, and to find that you all were doing such incredible work already, it's been exciting to jump in and put my energy into helping this grow. My day job is in news media. I don't come out of the healthcare world, but I work with investigative journalists, and we actually do a lot of reporting on healthcare and health insurance and those issues. So I spend a lot of my day thinking about this, and unfortunately reading some horror stories about some of what goes on that I would like to see fixed in the world, which again, is why I'm here personally. And I want to thank you all for welcoming me in. I can't wait for the work ahead. There's a lot to do.
Let me just stick around here. We are in the heart of Lane County, the Emerald City, right, Charlie? Is that the Emerald City, Eugene? And this Lane County chapter is on fire. They're doing awesome things. They're partnering with U of O. They're partnering. They're doing so much. And Lane County just continues to be one of our top sign-up locations within the state. Lou Siniger is the chair, but behind every chapter chair are other people helping do that work. And somebody we really wanted to celebrate with a UROC award is a longtime advocate, supporter, activist, and hero, Radel Perez Chica. Radel. Come on down. Gracias, Radel.
Yes, you'll never give up. There's a cartoon where the crane is eating this frog, and the frog gets the crane by the neck, and this guy's not gonna go in no matter what. So he's like, never give up. Remember that.
Never give up. You heard it here first. All right, and one more. And normally you might be like, wait, he already gave out 3, because we usually give out 3, but we wanted to make an exception this year because we have a very exceptional volunteer who's kind of like a half volunteer, half staff. We don't know what he is, but we know he's all awesome, and he's been such an influence this year. So Collin Stackhouse, please come on up. You rock, Collin, you rock.
Wow, this is unexpected. Well, I thought so I was a volunteer for about 4 years, and I sort of like put the pedal to the metal 6 months ago and I joked at a Portland chapter meeting that I feel like I'm kind of losing it because the world's falling apart, and if I'm gonna lose it, I might as well lose it consistently on TikTok and respond to comments. And so that's sort of been my thought process on that. And I imagined I'd get a rock, but now I'm staff, so this feels funny. But I'm glad to have it. And so, so we'll pretend like this is from before February when you started paying me. So, okay.
All right, give it up for our UROC award winners. Let me get a picture of you all. All right, thank you to our UROC award winners and all of you who rock. I'm going to gavel us closed so we can start the next conference. So I am now drawing the annual business meeting to a close. Hey, welcome to the annual conference, everybody. Good to see you. Seriously, for those of you that came in time for the conference, but maybe you missed the opening remarks, I'll just go into my bio for about a half hour, and then we'll get to, no, just kidding. Again, my name is Valdez Bravo, and I have the honor of serving as your newly re-elected President of Healthcare for All Oregon. Such an honor to be in this role. I use he, him, his pronouns. Such an honor to be in this role. I was drafted, tapped, recruited to get into this movement, like a lot of you, by a fellow by the name of Tom Sinsick. And so Tom is good at pulling people in and getting them to do stuff, and he got me to step up as vice president when Ben Garrett's had to step away. So I'm very thankful to Tom for getting me into the HCAO movement, to Tony, Kevin Geoffroy. I mean, Tom and I were the ones trying to talk about how we could get Shannon Saldivar to get on the board, you know, we're like for a couple years in a row now. So I feel like I'm so excited that this is the year. But, and it's great to see Demond, you know, hey, good to see you again. Last time I saw you was at that citywide health conference. Very cool to see you in Jensina. So this is the annual conference portion of Healthcare for Oregon. And so something that we're really trying to do is, you know, you all get invited and go to a lot of conferences where there's programming and networking, and there's a variety of purposes behind conferences, strategy sessions. And we're kind of hoping today is all of that. We've got some really exciting speakers lined up, both elected, some national voices. We've got some video special guests from Michigan, Dr. Abdul El-Sayed. So we're really excited about that. And so, and our keynote speaker, again, one of Eugene's favorite sons, Michael Lighty, who will be here speaking to us for our keynote speech after lunch. But in the meantime, the way, if you had a chance to look at the program, so we're going to have some opening remarks. We're going to have a great panel discussion led by Dr. Germann, Tony Germann, our VP, about Latino health coalitions and how they've advanced health equity in Oregon. We're also going to have, again, some video messages. We're going to hear from Nick Walden Poublon on his PSU United Health experience. Again, keynote Michael Lighty. And then something we're really excited about is we're going to have some breakout sessions. You know, we ask you every year, how is the conference? And you all let us know. We appreciate your brutal honesty. But one of the things that you said in the past is you don't like necessarily being talked at all day. And so we're going to do some breakout sessions at 2 o'clock, and we'll tell you about that. But you're going to have a chance to get into different groups about, one room is going to be crowd canvassing and grassroots advocacy, led by Lou and Robin, our union organizers. Coalition building in communities of color, Reyna, who's one of our panelists for the Latino Health Coalition. She's going to lead that conversation. Social media advocacy and talking to your neighbors. Collin's going to lead that one. You know, like all the people that say, I know about you because of TikTok. Collin's going to tell you some tips and tricks. Rural organizing and building bridges in Red, Oregon. Sarah Spansil, one of our board members, who was elected last year, she's going to lead that one. And then we've got some plans for you all on the Zoom too, so you don't feel left out. So we'll have a Zoom breakout session. Then we're going to talk about the Universal Health Plan Governance Board, progress to date, and next steps, and it's going to feature members. Amy, say hello there. Amy Fellows, Universal Health Plan Governance Board member. Mary Lou Hennrich. And I don't know if Dr. Chi's here yet, but he'll be also serving on that panel. And Dr. Chi is an awesome professor at Oregon State, helped start the Taiwanese healthcare system that I had a chance to meet with recently, and is helping us build our plan locally. And then we'll close out the day with everything you wanted to know about HCAO. Okay, we're going to try something. This is a very short video, but I think it'll set kind of a fun, giddy mood for the day. And let's see if we can get the audio to work. But the Portland chapter has issued, you're on alert chapters, a video challenge from the Portland chapter to the other chapters. So let's see if it works. Here we go.
you to a video making contest. Mystery prize.
Hi, I'm Jackie, and I lead the Portland chapter in the fight for universal health care because I believe decisions about our health should not be decided by a corporation. As a nurse, I've witnessed firsthand how people's lives can change in an instant because of insurance. As a nurse, it's hard to believe in what you're doing when you see patients continually denied services they need, also because of insurance. So, Portland is calling on every other chapter across Oregon to share your stories about what universal healthcare means to you. We want each chapter to create a short video telling us why you believe in healthcare for all. The chapter with the best submission will win a celebration party, and of course, major bragging rights. Submissions are now open through July 7th. Send your videos to Collin Communications, and the winner will be announced at our next mobilization. Good luck, and we look forward to seeing what you come up with.
All right, the Portland Chapter Video Challenge. Isn't that cool? And I want to thank the man here in the middle, Zach Alt, filmmaker, he's very passionate about this movement, is a very professional, experienced videographer, director, movie maker, and made that video and is here filming today. So give it up for Zach Alt. All right, okay. We're going to go back to the slide deck. So, all right, so our next speaker is somebody that's very special to have joining us today because, you know, I was joking with Lou, hey, we're in your turf today, Lou, but actually we're in her district. So I'd like to help me welcome to the stage State Representative Lisa Fragala.
So I am very loud, though. No one has ever accused me of needing to be quieter, or no, sorry, louder. Yeah, you can ask my husband, he's here. To usually be quieter, please. So my name's Lisa Fragala, and I am honored to serve as House District 8 representative. We are here in House District 8, and I like to say my district goes from the Willamette River to Spencer Butte. And so excited for you to be here today. So I'd like to start out by welcoming you all to Eugene. I'm thrilled that Healthcare for Oregon decided to have their annual conference right here in our community. Like you, I believe that healthcare is a human need, it's a necessity, and I would even call it a human right. And I'm proud. Really proud to live in a state that has put that into our Constitution. I think healthcare for all has played a big part in moving our state forward toward ensuring everyone has access to comprehensive, high-quality healthcare, that no one is left out of that. And I have been honored to participate in our local Eugene chapter. As a state representative, I'm excited to be here with you in solidarity and to work together towards ensuring Oregon has a universal healthcare system that is based on the well-being of every Oregonian and not for corporate profit. So to start, I want to thank you for your work in the past. I want to thank you for your work today, and I want to thank you for your work in the future. I also think Eugene is an apropos place to have Healthcare for All's conference, unfortunately. But in many ways, we've been the canary in the coal mine for patients losing access to critical care they need in Oregon due to corporate takeovers and a profit-based mentality. Thousands of patients in the Eugene-Springfield area lost access to health care when Optum, a United Healthcare subsidiary, took over Oregon Medical Group, which is a local healthcare provider. I've personally spoken to hundreds of people in my community who lost access to their care provider. patients with diseases like diabetes, genetic conditions, autoimmune disorders, and other complex needs. They were just told, go somewhere else, right? Just go somewhere else. Individuals seeking routine care or to fill prescriptions, which then turned into more significant situations due to the lack of access, they were told, go somewhere else. Lou knows firsthand about all of this. So individuals seeking people who were wanting to know where their primary care provider of over a decade were going, were told, we can't tell you that, right? That you don't have the right to that information. So the sad story is that Oregon Medical Group operated in our local community for over 36 years. And prior to being brought by Optum, they were well respected and considered a great place to access care. It was one of the reasons I personally sought care there. Had a great clinic 2 blocks from my house, which by the way is no longer there, they closed it. So not only is this an important issue to my constituents, but it's very personally important to me, and I'll tell you a little bit more about that. So in the summer of 2023, I was diagnosed with an aggressive form of breast cancer. Earlier that year, I had received a letter from Oregon Medical Group saying my primary care provider was no longer available. No explanation. I'm sure you can imagine the fear I experienced about my next steps and the anxiety about who would help me navigate my health care. And I'm gonna guess many of you understand this, but battling cancer is a master's class in how to navigate the healthcare industry. I am actually very thankful that I have that experience to inform me as a state representative and to take leadership on this issue. So the story does have a happy ending. Fortunately for me, I was able to get the care that I needed. But there are many in my community who still struggle, who struggled at that time. And just a little side note, it took me 2 years to find a primary care provider. I just recently found one. So when we see corporate consolidation in the healthcare market, we see 3 things happen: higher prices, decreased quality of care, and decreased access to care. And I think that is just unacceptable. Yeah. So that's one of the reasons I ran for office in 2024. This is my first session as an Oregon state legislator. And I knew that prioritizing healthcare for all Oregonians would be a priority for me in the state legislature. And so that's why in the current legislative session, I'm proud to have been a chief co-sponsor of Senate Bill 951. Yeah. Along with the House Majority Leader, Ben Bowman, who's done an incredible amount of work on this issue. So Senate Bill 951 addresses the lack of restrictions on corporate ownership that's left so many people without the health care they desperately need in a time when we have a serious shortage of primary care providers. It's about addressing a growing crisis in healthcare. And, you know, we have actually made great progress in Oregon when it comes to healthcare coverage. 97% of Oregonians have access to healthcare coverage, which is a historic high. But we have significant challenges when it comes to access and affordability of care. And I really believe this is in a large part due to the impacts of corporate consolidation and vertical integration within the healthcare industry without appropriate guidance of corporate ownership. So Senate Bill 951 helps to curb the influence of corporations in our healthcare system and reduce the threat of restricted access and the rising costs of care. It continues Oregon's long tradition of healthcare having local control with medical decisions being by medical practitioners. I mean, imagine that. We have to actually make it a law that doctors should be in charge of the decision. And patients, right? We should be able to say what we want for our healthcare. So at the heart of this bill for me is the idea that medical care should be between a doctor and a patient, and that decisions that intimately affect our personal health care are not made by corporations or profit. So I was very honored to work on this bill this session. I really feel it's about addressing what happened at Oregon Medical Group and is happening in other Oregon cities like Bend and Corvallis. And it's about closing significant loops that were in Oregon's corporate practice of medicine law that were being exploited by multi-billion-dollar corporations and private equity firms. As Valdez Bravo mentioned, Senate Bill 951 passed on the House floor a week ago Wednesday. And yep, we came to celebrate, and it's on its way to the governor for her signature. But let's be clear, right? We still need to do more. We are tackling this crisis around the margins, right? And so many times when we talk about healthcare issues and we talk about healthcare legislation at the Capitol, somebody has to take the time to explain how the bill will impact one of each of the 5 systems that we have in our state. I think it is really clear in those conversations that we need one system, everybody in, nobody out. But there are some other things we've been working on related to healthcare. There's a lot of additional work going on, and it is a priority of Democrats to ensure that all Oregonians have access to quality, affordable care. Early in the session, we passed a critical measure that ensures ongoing funding for the Oregon Health Plan. I'm sure you know that 1/3 of Oregonians, that's 1.4 million people, are on OHP. That's over half of Oregon's children. So just think about that for a moment, how critical that program is for children in our state. So I know it's also on top of mind, the threats to Medicaid funding that are being debated in Congress. And so the legislation that we passed early is really critical to maintaining funding, but we are also doing everything we can proactively to prepare for what might happen at the federal level. In another one of my committees, which is higher education and workforce, we passed several bills and approaches to address shortages in the healthcare workforce. This is critical to increase care. And the legislation that we passed included addressing a shortage of mental health care workers, which I think is just as critical as our physical health. And right now, we're really trying to get legislation out of the Rules Committee and to the floor to address how pharmacy benefits managers, or PBMs, corporate PBMs, are creating a shortages of pharmacies in Oregon and limiting access to the medication that so many Oregonians need. Since 2008, we've lost more than 200 pharmacies in our state. And I'm sure you've heard the recent reports about Rite Aid closing many of the pharmacies. We're okay here in the Eugene Springfield area. We have to wait in long lines, but in much of rural Oregon, it's a pharmacy desert, right? People drive to Eugene to get their prescriptions filled from Douglas County. So this is something that's really critical to address, but the pharmaceutical industry has a lot of power. And so I just want to give a shout out to Representative Rob Nose, who is leading the efforts on this. And I would encourage you to write to your representatives and to leadership, letting them know we want to see this bill make its final destination to the governor's desk this session.
Yeah.
It is 3212, House Bill 3212, and it's in rules right now. I additionally would be remiss if I didn't mention the important work of the Universal Health Plan Governance Board. And that continues to make progress, and I'm excited to see the results of this work this fall. The work of the board to design an equitable, affordable, single-payer universal health care system for Oregon is something I strongly support. I routinely talk with other representatives about why it's so important, and one that I believe is an incredible opportunity for our state to take leadership and show the rest of the United States that we can do this.
Yeah.
So again, thank you for the opportunity to be here today. Again, thank you for the work that you all do. I want to give a shout out to Healthcare for All Eugene, who does amazing work here in our community on these issues. I want to appreciate the organizer of today's conference. Thank you for bringing us together and for including me in the conversation. And I hope you have a fantastic day. And I, you know, as a second grade teacher, it's paining me to see you all sitting for so long. So I also want to give you a moment to just like stand up just for a second. Come on, like humor me. Stand up for a second and just give it a little wiggle, right? Because when you get that blood going, your brain is even more excited. So again, thank you so much.
All right. Thank you so much.
All right. Well, thank you, everybody. We're running a tiny bit behind, but really excited about the next segment in our conference. Our panelists are going to be joining here. I'm going to introduce them individually here, but I am so grateful for the three of them to come and join us today. These are friends of mine who I have suckered in to come and join here, but I know they're here for all the right reasons in talking with them. As you know, I work in Woodburn. I'm a family physician and work with the Latino community for the entirety of my career. And I have been so fortunate and graced to work with colleagues. And I've asked them to come join us, and I'm going to introduce it. Unfortunately, we had Olivia Quiros, who was going to be here today. She had a family emergency, and unfortunately would be here. And she was going to do a bit of an introductory presentation. So I'm going to do my best to fill her role, but there's no way I'm going to do that as best as she could. But I do want to jump in with introductions in here, and then we'll jump into that slide presentation. So first, I want to introduce Representative Leslie Muñoz, who represents District 22. Yeah, give it up, give it up. Representative Muñoz is a labor organizer, education advocate, and working mom, dedicated to building stronger communities where all families can thrive. The daughter of Mexican immigrants, Leslie grew up seeing firsthand the sacrifices her parents made to give their children a better future. Today, she fights for workers across Oregon, advocating for fair wages, safer working conditions, and the respect every worker deserves. From school staff to healthcare workers, Leslie stands alongside those who keep our communities running, and she continues to lift up voices that are too often ignored. Our next panelist is Reyna. And Luz is a grassroots organizer, a public servant, political strategist, and a nonprofit leader. She is the daughter of immigrants and a first-generation college graduate from Willamette University, where she earned her bachelor's degree in politics and Latin American studies. She began her career in Portland, Oregon as the healthcare and immigration policy advisor to Congressman Blumenauer, campaign manager, and later as executive director of East County Rising, a political action community that recruits, trains, and runs candidates in East Multnomah County. Luz specializes in recruiting, training, and supporting new representative leaders while engaging historically underrepresented voters. She believes that helping new leaders run for office and engaging our evolving electorate are powerful tools to transform our communities. Next is Anthony Veliz, who's the founder of Valdez, Oregon's Latino Leadership Network, a nonprofit organization. Valdez is a collective movement over 100 Latino-led and serving community-based organizations and private sector businesses, plus thousands of Latinos across Oregon. Valdez raised over $5 million to help fight COVID-19 in the Latino community during the height of the pandemic. Anthony is also the owner of EZO Public Relations and Marketing, a multicultural agency specializing in the Latino community. It is a people-focused, purpose-driven advocacy agency. He is the first Latino ever elected to the Woodburn School District and the only second Latino elected to serve on the City Council of the City of Woodburn. A little bit of the purpose of this panel discussion is that we are stronger together. We are stronger when we connect with our community members and our communities at large. And so the origins of this was just a discussion that, again, how do we connect with our broader community members and with a demographic that I would argue that Healthcare for All Oregon has had a connection, but not as strong a connection as we need, and that is the Latino community. And that's why we've kind of hosted this event to create more bridges and check in on how we can be better together. I'm going to stand up for this PowerPoint. So if we go to that next slide there. So as I mentioned, Olivia, really sad she couldn't be here, but she was kind enough to share a little bit of a presentation that she brought to a speaking engagement that Valdez had put together for some students for Portland State University Public Health School. And it really just stood out to us, of how progress can be made. And so she put this together, and like I said, I'm going to do my best to go through it, but we can go to the next slide. And it's talking about the Healthier Oregon program. And we're going to talk about a little bit of the origins of how that program was created. And I'm not going to read all this, but I'm just going to tell you, in my work at the state, working on the Health Policy Board, also I served on the task force for the Bridge program, and Healthier Oregon is a lifesaver for my patients. So I serve a community at a Salud clinic, and 16,000 patients we serve there. 50% when I started work there were uninsured. I just checked the numbers because I just presented to the Senate Health Committee just the other day, and we're down to 10%. And it is a big portion. That's huge, and I value that work. But the challenge is that we see the threat of it actually being pulled out totally. And I think we need to be real about the piecemeal system that where we're putting these Band-Aids that Mary Lou was talking about is they are working, but they're not working, right? And I think we need to be real about that. And this program is instrumental, so I'm gonna raise up the merits of it, how the coalition came to it. But what Healthier Oregon program is essentially is saying that if you live in this state, and you make a certain amount of money, which is our Medicaid threshold, which is 138% of the federal poverty level, then you should qualify for Medicaid benefits as anybody would, right? In an equitable distribution of care and access to care. And that's what the Healthier Oregon program is. It is a benefits package that is OHP, Medicaid benefits, that goes to anybody that is at that income bracket of 138%. Let's go to the next slide. So this is a bit of a timeline, and they're kind of lengthy, and I don't think I'm going to get into it because I think the value of the conversation is with our guest speakers here. But you can tell that this started in 2009 as a campaign that was driven by the Oregon Latino Health Coalition in starting that. And it started in a number of smaller bills and ideas, and that started with Healthcare for All Children Act in 2009. But then in 2015, you had House Bill 3725, with collaboration OHA and Oregon Latino Health Coalition, implemented safety net grants, and then moved into a campaign that broadened that to over 90 organizations to get past this legislation, to get this coverage. And that includes just a number of organizations and groups. You feel, as you move forward, you see that actually the bill was passed in 2017. and then came into effect in 2018. And we can go to the next slide. And this is really what took place for the next step was not just children, but then it became everybody, right? And so again, just broadening coalition to work at small pilot programs, looking at different of those age ranges, and it was implemented in segments. So it was covered those 19 to 26 and those over 55 of age, and then it was transitioned into everybody being covered, again, at that income bracket, 138%. You see broader coalition taking place with unions, with SEIU 49, and then let's go to the next slide. Again, there was a lot of dates on here, and I think it's the most value for everybody's time. And in 2022, it was about implementation, and it was about advocacy, and it was about the organization speaking up, here's this program. How do we make sure it gets to the people that need it? And that's a really important piece, and that's what I see. And I know Leslie and I have talked a lot about that, particularly with maintaining the Healthier program. Let's jump into the next slide. So now we see this year that the implementation has taken place, what we've seen is 100,000 lives get covered on this program. And as I mentioned in my clinic, that is instrumental to people getting the meds they need, getting the treatments, getting the interventions, getting to the specialists, getting transportation to the specialists so they actually can get it. But it is also about how do you do that outreach, and how do you make sure people are aware of that? And I hope that's going to be some of our questions today to speak to that. Let's jump to the next slide. This slide is really just talking a little bit about, as we've reached here in 2025, already mentioned by Representative Fragala, that, we're at some serious risks in the state with regard to Medicaid funding. And we need to raise this front and center of the mission we're doing, but also maintaining what we have, because that will mean people will die. Right, just quite frankly, I will see my patients not get the care they need. They will forego the medications. They will forego those interventions, and it is so important for us to be front. And as healthcare Oregon, as I mentioned, we are linear in making sure that we're getting to single payer, but we understand, and we have been an organization that has paired up and broadened coalitions to tackle things like Senate Bill 951, the corporate practice of medicine, right? To make sure that we're paying attention to the Healthier Oregon program. So let's jump to the next slide. So Olivia just kind of mentioned some of the wins, and this is what I think we're going to jump in a little bit of our questions, is that the effectiveness of these campaigns is that it included a bilingual outreach of enrollment and system navigation. System navigation, that is really hard. And I do see that every day in working with the Latino community, with language and cultural differences, and making sure that we're engaging in that messaging and connection in the appropriate way. As I mentioned, there was about 98,000, close to 100,000 that were enrolled across the state. Oregon joined 5 states that have expanded Medicaid coverage to undocumented people. And really the most important was that coalition building and partnerships across our state. We all know the challenges. I'm not going to get into those. This is, again, that piecemeal is that when we look at the churn, we know that 138% of the very popular level is not a big difference if you do an extra shift at your work. If you take one overtime, you could flip over to 139%, and then you're not qualified. I see this every single day in clinic, and it is so disheartening to see. And so, Medicaid is a really fundamental piece to our health system, but it is flawed the way we do it. This is why we're here today, to talk more about that. So I'm going to jump in and talk with our group here just about some general questions. We'll stop out and just see where, everybody's opinion. We can just maybe start with Leslie here and move on down and do some targeted questions too. And my first question is, what are the most significant barriers that Latino communities face in accessing healthcare in Oregon? And how can, with our respective roles and organizations, how can we jointly address them?
So good afternoon, everyone. It's a pleasure to be here with you today. I'm Leslie. And going into the legislature, they asked me what committees I wanted to sit on. And I kind of thought about my area, and I happen to be in a district that's a majority district. And one of the things that I heard at the doors was that people needed medical care. I'm an intelligent woman. I have 2 degrees, and I don't know how to navigate the medical system. For the most part, I try not to be sick because I work really hard. And I have appointments that are scheduled months in advance, so I'm not going to miss those appointments. I feel it's unprofessional. So I haven't had a lot of interactions with the medical world at all. And so I decided that I was going to ask to be on the higher ed committee with my great friend, Lisa Fragala. We have a good time there. And then I decided I wanted to be on labor and workplace standards because my background is in labor. And I decided I wanted to be on healthcare. And when I was asked by the speaker, they make a little meeting with you where you talk about what your wishes are in terms of appointments to committees. I told her it was because I needed to learn more about how I was going to help people that looked like me get medical appointments. And that's basically what I knew about healthcare. So nothing. And so she appointed me to the committee. And it has been eye-opening how the medical world doesn't work in Oregon. It's a very complicated system. We have 5 different systems for medical care. All of them don't interact perfectly. And then there's like CCOs and providers and associations and medical boards, and it's just really complicated. And so one of the things that I was thinking about is when you throw that system into the fact that a lot of the people that look like me live in poverty, they have 2 and 3 jobs, they can't get the day off to get to their medical appointments. It's really hard to make a medical appointment. You have a language barrier on top of that, and the system's problem. Transportation is a problem. A lot of us don't have driver's licenses. It just gets more and more complicated. So rather than learning a lot about how I can help people, I've become very devastated about how I'm going to do that. So I am just really excited and thrilled to see that people get together and talk about these things, because I actually came here to learn from you all about what I can do better. And I like your idea. I've seen you all at labor events, and you've talked to me. I've talked to a couple of you in this room about this idea of simplifying, what we have. And I forgot my question. What was the question?
I think, really just, maybe you observed working in Woodburn, I think some of the barriers that Latino communities face. And, I think, just what maybe your observation of, some North Stars and where we can look for together collaboratively. And then I guess in your role in the legislature and thinking about, this legislative session is coming to a close and you've done amazing work as your first session. But thinking maybe just your next, big round of applause. Maybe your perspective in maybe coming into next session in the future of how we can address health for Latinos.
So one of the things that I did observe on the healthcare committee is that our voices are missing. So I've been sitting in that committee for about 5 months, and out of all of the people that had testified, all of the association boards, all of the CCOs, all of the providers, everyone who has ever come in, I've seen 3 Latinos testify in committee or in committee at all, and 2 of them were brought by Tony. There's one other gentleman. And so one of the things that I keep asking myself is, why are we missing in the conversation? So I'm trying to see how we can fix the work flow issue, but like, how can we get into schools and talk to our kids, like our Latino kids, about how this would be a really great place to work? I think is a great place to start. I just want to see us be more involved and more a part of the conversation of coming up with solutions. Because if we're not involved in coming up with solutions, we might not agree with your solution, and then so we're not present again. Thank you.
Let me just ask the question again, Luciano, kind of similar. I really just think, again, fundamentally, how are we going to improve the quality of care and access to care for the Latino communities? And from your role is from organizing and from helping get tremendous, representatives like Representative Muñoz in the right spot. But, how do you think that we can organize with respect to, some of my questions is, Healthcare for Oregon is working to partner. How can we be a better partner and find alignment and shared goals?
Absolutely. Thank you, Tony. And I love that question. And before I dive in, I just want to say thank you to each one of you for spending your Saturday here with us, because in the state of our nation right now, it's people like you who are the beacon of hope for us and for this country. So I just want to say, keep showing up, keep fighting, and don't forget our values and what we're fighting for. Let's not, let all the dynamics at play keep us down. So I just want to say thank you for being here. Very encouraging to see you all here. And Tony, you presented a great question about, how do we mobilize Latinx communities for such an important issue like universal health care? I think it's no lie that this healthcare system no longer works, and that we're at this point where something's got to give. And from my experience in organizing, the most recent campaign, aside from working with wonderful electeds and candidates, but the most recent campaign that we've worked on is called Community First, which is I'm sure you all have heard about the OHSU and the Legacy merger. So we ran a community-based campaign to mobilize CBOs so that we can ensure community-led governance of the charitable assets that would be coming from this merger. The reason why there are charitable assets coming from this merger is because Legacy is a nonprofit. So upon selling to OHSU, Legacy would have about $600 million in assets that would go into the philanthropic ecosystem. So for me as an organizer, I think, okay, there's flaws in their healthcare system. Now, how can we supply and help our nonprofits and community health workers with funding so we can plug in where the system is failing? And so that's why there's a lot of wonderful organizations that are doing such incredible work, Latinx-based organizations that we were able to mobilize and get them in the coalition. So Healthcare for All Oregon is a great endorser, by the way, of the campaign, so shout out to you all. But we have folks like Latino Network and Centro Cultural, Oregon Latino Health Coalition, Familias en Acción, Capaces, and Unidos in Latino Coalition, the Latino LCA in Bend. So, and what I've seen from mobilizing these organizations within this campaign
we
is
got
that
something exciting happening over there.
We need to have more opportunities to bring
There was
folks
one other game
together.
to play,
And I
it was
see
Ninja.
Healthcare for All
I'll check out that
Oregon
last
being an
match out on
umbrella to do
CT2.
so.
Very nice
I think
for
this is
CT2.
not only
Like,
a
don't take
kind
your
of
eyes
an
off
umbrella
the screen
issue
for even a
where
second.
we need to fix
Yeah,
our
but
healthcare
we do
system.
have
It's a
something
multicultural
very
issue,
cool
it's
as
a
well.
racial
Even though
equity
Reed's
issue,
not getting that last match, the
and
person
so
that will be taking
healthcare
his place
is
at 48
murderless.
seed is
Healthcare
Walden
is
Sofa,
is
Canadian legend
equity.
coming.
And so this is a very multifaceted movement, which is why I see Healthcare for All Oregon being on the rise with the people power, with the political power that you're building. So I'm really excited to learn from you all as well about what do you see happening? I'm here as a listener, as a learner as well, and here to support the mission.
Thank you, Luis. Anthony, Valdez has done just a remarkable job, in the last, couple of years, decade, and joining in the Heritage Breakfast and your leadership on that. It's really incredible to look at the breadth of, looking at workforce issues, business, looking at education, right? And, I guess my question, similar to kind of what we've gone down around, is, how do you envision or see how Valdez could pair with Healthcare for All Oregon, or how can Healthcare for All Oregon help, Valdez in its work? We had that conversation on the phone the other day, the challenges that we have as a smaller organization. But, together, again, I mentioned that we're better, right? So I guess that's in general kind of the question is, how can our amazing groups work better together?
Knock that down. Buenos dias. Good afternoon. Anthony Veliz again. I'm from Woodburn. And first of all, I'm always humbled. Thank you for the invitation to be invited. I don't get a lot of opportunity to say thank you. Gracias. And I will say on behalf of the Latino community, especially in Woodburn, where my family's been there for 5 generations since 1943, former farm workers, thank you for helping us not only survive, but thrive, because it's through your work that I'm here today. My life has come full circle. I was born into the farm worker labor movement with Dolores Huerta, Cesar Chavez, and through the this place reminds me of when we used to meet at the Colegio Cesar Chavez, which probably a lot of you don't know about, but it was the first and Chicano Latino 4-year accredited college in U.S. history. And of all places, it was in Mount Angel, Oregon. Check out the OPB video when you get a chance.
It's a great video.
Yeah, but my point is that I come full circle because when we were working out in the fields, picking strawberries near Woodburn, I remember the crop dusters coming by us. And then we would just, obviously they were laying pesticides, right? And we would just hide, and it was like rain, and then we just keep working, right? We were that naive that we didn't know what was happening to us. And obviously a lot of us became sick. Because of that, Salud Medical Center was born. It was a community grassroots effort to bring healthcare to farm workers, which my family, we were part of that. And coincidentally, my mom was the first employee of Salud Medical Center. So, yeah. So all these decades later, right, here I am, right? And here we are. And again, I think to answer your question, this is what I was built for. I was born into a labor movement. That's all I knew. Like, I admit this publicly, but I've never met a leadership book, like, completely. But working out in the fields, I see Mrs. Ibarra, my mom, my dad, my grandparents. They were my role models, my leaders. I saw how they could take, nothing, a little bit of food, and make it like feed 20 people, right? And so it's just that perseverance, all of that. So it's that si se puede spirit and attitude that I think why we're here today. So to answer your question, how poder, it was just, it's an Oregon story. It didn't start with me, and it won't end with me. This is just a piece of a long legacy of multiple generations of Latinos advocating for us and for all Oregonians, to be frank. So my little piece and my little part of the world, and I do this with all humility, is to just do what I've always been doing and seeing what I know how to do, organize people. And what I kind of see this as, I feel like I just like to set the stage, and then I know that everybody in here, including those, have a gift, and I just let people kind of gravitate to where they have that energy, their spirit takes them, in many ways, and then I just let them do what they do. But it's, I kind of like just help guide, right? That's all, because all of you are leaders in your own right. And I'm just the humble servant, that's how I feel. And poder, that's our attitude, is just to serve and to guide and hopefully build relationships along the way and make a difference while we're here.
Thank you so much, Anthony. In your comments and kind of what you're talking about, and I see this every day, is we mentioned a lot of my community has 2-3 jobs, right? And I think a lot of people across Oregon are working so hard. And why do they need to pay attention to healthcare, right? But when it comes to the time you need healthcare and it's not there, well, that's a problem, right? And we're seeing more and more of that. My next question is, how do we reach community that is working so hard? How do we reach a community that is not as perhaps well connected to normal channels, right? And to understanding of the fundamental issues. And we see this all demographics, but I see a lot in my patients, because they are working so hard and that there's language barriers, there's cultural barriers with that. And, I guess I just offer up to the group to see, how do we get the message of we're trying to get people that there is a better way. There is a way that would bring a more equitable healthcare system and access to care that would deliver better outcomes for people. How do we get that message out?
So by being very intentional, A lot of the time when I look at equity, it kind of seems like equity is treated like a luxury. Like if there's additional money in my budget, I'm gonna go out to dinner, but if not, that's okay. That's how I see equity is treated. Like we take care of everything else first, and then if there's additional resources, if there's additional energy, or if there's additional, personnel, then we go out and we do equity work. And I think that getting people that, that have done this work, like Anthony and Luz and I, together at the beginning of your plans, so that you can start making your plans and strategizing with that peace in mind of how you're going to bring people to the conversation is super important. And then also starting at a more basic conversation. I think a lot of the times these conversations happen at high level. And I don't know, we're not a monolith and all of us communicate differently, but in my family in particular, we communicate through stories. That's how we connect. So starting with a story about how we needed healthcare so that people can start kind of thinking about their needs. I'd say a devastating story about when I needed healthcare because it brings attention to the problem and people like children. So I tell people that when I was a kid, I had a problem with my tooth and we didn't have access to healthcare. My father was a landscaper, my mom was a homemaker. So a bunch of parents that needed dental services for their kids got together and they brought this guy from TJ and he performed dental work in my backyard. And so I had a root canal in my backyard and Clorox was what I used to like rinse my mouth. It was the most painful thing I've ever been through. And I've had a C-section and given birth 3 times. And so when you say a devastating story about how missing healthcare in your life ended up in you having a root canal in your backyard, it's a more compelling story than talking about healthcare at this high level. So I think we have to put those stories about the tragedies that are happening for people that don't have access to healthcare in the forefront for people to understand what that hole is creating. So I think we just need education about what that means for people when they're missing healthcare.
Thank you, Leslie. And you unlocked a memory for me, because growing up, similarly, I'm a daughter of immigrants, and during the summers we would go pick berries. And I remember there would be times that my dad would be sick, and I would say, "Oh, you can just take a day off, right? We'll just stay home." He's like, "No, we have to go." Right? And I remember feeling like, "Oh, that's normal. Okay, we're sick, but we have to go." Or if I'm sick, like I just have to go to work, right? And I remember that being normalized until I then entered the workforce, and people were taking sick days off, and I was like, "We can take sick days off, and we get paid." And I was like, "We can take sick days off," and I didn't realize growing up that was actually a thing because my parents, if they were sick, they drink a lot of tea, ginger tea. They would do whatever they can so that they can then be okay to go to work the next day because we couldn't afford to take a day off. And I realized a lot of families have experienced that same pressure of I have to go to work because I can't miss a day. And so similarly, when organizing and knocking on doors, asking folks to vote or asking folks to show up and volunteer is also kind of, sometimes a big load for people who are working 2 or 3 jobs. And I've seen that over and over and over again. But what I've realized within our community is that we are so relational. Like we are so relationship based that, if my dad hears that, oh, there's this physician or there's like, a salud, or like a clinic that serves, immigrants or that, then there's like a kind of implicit trust in saying, you know what, I can't take a full day off, but I'll take half a day off. I'll take a couple hours to go, right? Because there's also this fear. My grandpa also hated going to the hospital. He never went because he didn't trust it at all. And unfortunately he got sick and, but I think there's a lot of inherent distrust. And if we can lead with relational organizing and lead with, relationships and building our relationships with folks, I think we inherently build more trust, which means that, we build more, a stronger network and a stronger community. So that would be one way I think we can support the Latinx community more.
I think fundamentally what I would ask is that I think you have to actually be seen first, right? I grew up in my generation, we were never seen. We were this invisible group of people that you could go up and down I-5. If you happen to look left and right, you can probably do it today. You'll see Latino community out there toiling in the field, right, for hours. And that was me. I used to watch I-5, cars going back and forth when I was like 5, picking strawberries. And you would think, man, I wonder what they're doing. I want to do that. So I think fundamentally we have to acknowledge the Latino community. We're a large community, but if we're to ever get acknowledged, then I think that's kind of fundamental. But once we get through that, I think it's really, I would just echo, it's all about relationships. And we're all different, right? And I think it's just opening up the opportunities for Latinos to get involved. Might not be the way it's traditionally done, but I think obviously language and culture. One thing I know about us, if you invite us, we're gonna have a good time. We're gonna have a lot of good food, probably have a little bit of music, but hey, maybe spirits later on in the day, but just saying. But no, I think fundamentally, I think, we're people, right? We're human, and I think we all want the same thing. And I think that relationship, once we get to know each other and break bread with each other, I think a lot of good things will come, so.
Yeah.
Thank you all so much. And I know it's kind of the time. We might just do one more question, and then I know people are interested in getting to lunch here, so we're going to move in. Along those lines, one of the things is making sure that we are lifting up the voices that need to be heard, right? And I think, Anthony, you raised this, and, so what we want to do is create a system, a universal health system that has the inputs it needs, right? And there is the Universal Healthcare Governance Board that is moving forward, the number of committees doing phenomenal work. And I guess my question is, and you've done tons of work, you're living it, right? How do we create more space and opportunity, and how do we as Healthcare of Oregon empower those voices to make sure that people are at that decision-making table? It is volunteer a lot in those spaces. We've talked about this, but I guess just in general, how do we get out that message that people can contribute to what's going on at those committees and voicing those opinions? And in general, how do we get people there?
So the voluntary piece, I don't see as an issue. We're community oriented, and if we feel like, the meeting is of value because it's going to bring something back to our community, we're very willing to put in the work. We like working hard. We're about storytelling. We come together, and we can volunteer our time just as quickly in this space than in any other space. I guess one of the things, like I've been working for labor unions for a very long time, and a lot of the times when I look at the executive boards, that I work with, I don't see people of color, and I ask like, hey, where's the people of color? I know we're here. Where are we? People are like, well, we don't really know how to invite them. Like, what are we gonna say? I'm like, well, you were very intentional about having elementary person here to represent. You want middle school over here on your executive board. You want some SLP, some SPED people. You want high school people. If you want people of color, call them and be like, hey, we need representation. It's super easy. The same way you were like, we need a second grade teacher. Call us and tell us that you need a person of color, and we will be there because we care about the people that look like us, having decision-making power. So invite us. Let's invite us. We'll be there.
Absolutely. Yes. We love to be invited to stuff, and because it feels that like it's personally, it's an honor always to be able to be in spaces where maybe historically there hasn't been a lot of Latinx people, but if I'm the only person, I make it my role to then bring in more folks. But what Leslie said, invite us, and also I think there's a lot of value in co-creation. When running campaigns or working on projects, involving folks, I think, comes from the get-go. It's not just something that it's a box we check off, or to say kind of like, oh, well, we already included feedback and then bye. But it's rather, how can we intentionally from the very beginning have conversations with folks so we can co-create a plan together. We can co-create a campaign plan. We can co-create a vision together, right? Because when you can create buy-in from multiple folks from different perspectives, you're bringing them into your coalition. You're building power together. So I think there's a lot of value in that. In sometimes campaign world can be really fast, but I always say slow down so we can go further together. And so that's what I would say is including folks, in the creation process, right, in the brainstorming process.
Well, that has evolved. We started as a collective movement of hundreds and thousands of Latinos all across Oregon during the pandemic. But now we've evolved, and we kicked off a Poder Action Alliance, which is a C4. And we've been advocating for House Bill 3650, which Representative Muñoz, who's my representative, is leading this charge. And it's a new experience. It's for some it's new, for others we've participated, but I think that's that being proactive, not waiting for somebody to do this. This is I think the story of Latinos, is not waiting for something to happen, but go make it happen. And I think this House bill, hopefully it'll be successful. We'll create a Latino healthcare task force, which will really study the healthcare in the Latino community, and hopefully we come out with some good policy. But it's going to take all of us collectively to support one another. We're all, healthcare impacts everybody, and as we know. But I think that it's my responsibility and our responsibility too, for those of us that are privileged and have, done a little bit in our lives to help in every way that we can. Those that are actually outside working right now, whether it's construction, in the fields, anywhere. So I take that with great honor and serious to be here today and hopefully move the dial a little bit.
Well, thank you all so much for being here. Really appreciate and really valued the conversation. Just a note, Luz is going to be helping host a breakout session this afternoon. I encourage you to check in on that as far as broadening our coalitions. She has a wealth of knowledge in this space, and I think it'll be a really productive breakout session. I'm really thrilled by that. Okay, with that, really appreciate all of you, and I think we're going to, Valdez, any other announcements before we...
Give it up for our panel discussion here. Tony, Leslie, Luz, Anthony. But we had an opportunity to welcome one more guest who we were only able to shoe in at this exact time. So we wanted to welcome really quick, and then we're going to go to lunch. And don't worry, we'll make up for it on the back end so you get some food. But I wanted to welcome our State Representative Nancy Nathanson, who represents House District 13, which includes North Eugene's, Cal Young, Good Pasture, Harlow, Northeast Neighbors, River Road, and Santa Clara neighborhoods. Those of you likely know, especially if you're from this neck of the woods, Rep. Nathanson has served in the House since 2007. Part of that, Eugene City Council for 12 years. And she currently chairs the House Committee on Revenue and is a co-chair of the Joint Committee on Information Management Technology. And pertinent to our work, she has received awards for legislative service from organizations including the Oregon Primary Care Association, Oregon School-Based Healthcare Network, AARP, Oregon Partnership to Immunize Children, Community Providers Association Oregon, and Lane Council of Governments, outstanding elected official in 2019. So without further ado, a few words from Representative Nancy Nathanson, and then pizza.
Hey, everybody. Wow, it
Oh, yeah.
takes a long time to accomplish change, doesn't it? I am so impressed with your work because you all, some of you in here,
were years ago identifying the problem is the system, not the little things around the edge. It took you all these years of work. We still haven't changed the fundamental system, have we? But the legislature keeps pushing at the edges, doing what we can. Real change takes a lot of work. Some people think, oh, we're going to have a rally and then things change. It takes a rally times 365 times 5 years, I suppose. Keep the pressure on. You are the early birds that told us what we needed to do. While we wait for change at the federal and the state level, I wanted to tell you more like an insider's point of view, what's been going on behind the scenes at this legislative session. So, you know, corporate practice of medicine, you're the ones who identified it. In 2012, about a quarter of all physicians were employed by a hospital or a corporate entity. That's flipped. Instead of a quarter, now it's more than 3/4 are employed by a corporate entity or hospital. Since 2019, more than 44,000 U.S. medical practices were purchased by corporations. You all know this stuff. This is what I tell my colleagues every time I testify about a bill. I introduced several bills this session to tackle corporate practice of medicine. And in addition to my own bills, I was working with Representative Ben Bowman, who you've been hearing a lot about his work, I hope. Representative Bowman and I worked together very collaboratively for over a year. I had started on things in the previous session, so had he. We decided to work collaboratively and strategically. He had a bill that was going to be introduced not in the House this time, but first in the Senate. I would introduce 2 or 3 bills in the House, and we would both support each other's legislation and push for it, hoping that something, anything would pass ultimately. So what we did, his bill was 951. It ensures that practices are owned and controlled by licensed medical professionals. That's the who's in charge part. Here's what I was working on. His bill started in the Senate, my bills that started in the House. I really want you to know what's going on behind the scenes so you know how tough it is, this fight that you're helping us fight. First, I had a bill to prevent non-compete clauses in contracts. All right? Then, when it looked like my bill was going to be running into trouble, I was contacted by Senator Posansky, you know Floyd from here, Senator Posansky and Senator Anthony Broadman from the Bend area. We talked about they had bills on the Senate side. I would sign onto their bills. They would sign onto mine on the House. We would push together. Ultimately, I became a chief co-sponsor of Senator Broadman's bill on non-competes, and his bill did pass the Senate and made its way to the House. So we're thinking, okay, something's going to happen. His bill or my bill. They're both sitting in a House committee now. However, I also had a bill for physician in charge. It said very simply, if you're a physician in charge, you have to live in Oregon at least 75% of the year. Duh. It shows you're an Oregonian, right? Well, people didn't like that one, some of the big interests. I also had a bill. You can pass all the legislation you want, but if there's no one to enforce it, what's going to change? After I kept pulling strings on why not this, why not that, it finally became clear in Oregon, the Attorney General does not have the authority to investigate or prosecute in almost all aspects of healthcare. That is just a total puzzlement. So I quickly, starting last fall and early winter, started writing a bill. I worked with the Attorney General's office and Oregon Medical Association and others to write a bill to give the Attorney General the authority to investigate and prosecute.
Yeah.
So I worked my tail off. My staff worked so hard. Other people were supporting all of those. None of those bills passed ultimately. The bills that would have defined physician in charge, prohibit non-competes, give the HE the authority. I'll admit, I was pretty steamed, and I am still pretty steamed. There was a lot of headway, a lot of great support and energy from you all, from physicians, from a lot of good places. But ultimately, there are some very powerful actors, including the insurance industry, that made sure that those bills weren't going anywhere. So it's not only corporate healthcare, it's the insurance industry. David versus Goliath. I need the different version of that. Meanwhile, I still have 2 bills that are in play. One will bring some regulation and order around urgent care. Did you know, of course you recognize hospitals are licensed and heavily regulated. Doctors have licenses, plumbers have licenses. If you get a manicure, that person has a license. An urgent care facility is not licensed. It's not regulated in any way. So I have a bill to at least get started on registering and demanding certain basic bottom line functions. That bill is sitting in Ways and Means. I don't know if it will get funded, but we got it at least out of a committee. And I have one more bill on credentialing and impaneling for people who work in sensitive jobs where they need credentialing and background checks. I'm trying to help people get to work more quickly, but safely. Everybody still has to pass background checks. Everyone still has to be credentialed, but the system takes 2 to 3 months. Some of you or people you know are waiting for care. You're waiting for someone to be able to help. They're waiting for work, and the system is just too dang slow. I'm trying to fix that. So anyway, I still have bills in play. Some of my bills that you all helped with and testified on died, but the big bill, Representative Bowman's bill, 951 that started in the Senate, it ultimately passed. We got a win this year. It shows that in Oregon, we recognize people over profits.
Yeah.
Give it up for the championing of Representative Nancy Nathanson in Lucky 13, District 13. Thank you so much. And I think you can hang out for a little bit. So if you want to come up and talk to Rep. Nathanson. All right, it is that time. It is lunchtime. Well, thank you so much as we come back together. We're going to have a series of short videos. We're going to be hearing from Dr. Abdul El-Sayed, who is a public health professional from Tom's home state, Michigan. Huh? I don't know where he's at. I'm pointing the hand. You ever do that Michigan thing? So he's running for Senate, actually, out there in Michigan, but he's a public health professional and advocate. During COVID, when we were all on Zoom only and couldn't be around each other, he came and spoke to our board one night. It was really a great session, and I really appreciated him doing that. But let's go ahead and hear from Dr. Abdul El-Sayed, a few words from Michigan, all the way to Portland, or Eugene, Oregon. All right. All right. Let's see if it works.
Healthcare for all Oregon. Abdul El-Sayed here. I just want to tell you how proud I am of the incredible work that you're doing. I know that there's a lot of darkness out there. When you look at Medicaid cuts, the fact that they want to literally gut a program that provides healthcare for upwards of half the kids in my country, and likely yours, it is disgusting and it's abominable. At the same time, there is light, and that's because of the work that you all are doing. When I think about the Universal Healthcare Governance Board, that kind of work is what leads to an Oregon, ideally in America, where every single person gets the healthcare that they need and deserve. Shouldn't matter what they do for work, where they were born, what their parents do, whether they're married or divorced, or if they turn 65, that no matter who you are, you get access to the healthcare you need when you need it. That's what you all are doing. And so my message to you is that I hope that you don't give up. I hope that you continue to press forward. Politics can feel sometimes like a pendulum, and I know how far back we are when they're ripping away Medicaid coverage from folks. And my question is, what is the work we're going to do to move it back in the right direction, toward justice, toward access, toward in an America where for the first time in our history, you can go and see a doctor without the pain of falling into debt and get the care that you need. And let's keep that in our mind's eye, because that's what we work toward. That's what we're working for here in Michigan. That's what we need to work for in Washington, D.C., and that's the work you all are doing in Oregon. I'm so sad that I couldn't be with you all in person today, but know that I'm with you in spirit. information that's kind of flying around about my bill, the New York Health Act. Now, there's some concerns that are coming from within labor and some legitimate concerns, but some, unfortunately, are not real. Let me start by speaking directly to my brothers and sisters in the labor movement. Organized labor built the middle class, and you have fought hard for your health care. Now, the New York Health Act honors that fight and does not take anything away from it. Matter of fact, it guarantees comprehensive coverage to include medical, dental, vision, hearing, prescription, and long-term care for every New Yorker, including every member of every union. And that last one, long-term care, is one that is not included in any plan that currently any union has. Now, the New York Health Act doesn't take healthcare away from unions. It takes it back from insurance companies. Right now, even great union plans are held back by rising premiums and shrinking networks. The New York Health Act guarantees comprehensive, no deductible, and no network restricted coverage for everyone, union member or not. And here's the truth. By taking healthcare off the bargaining table, unions can gain leverage to get better wages, stronger contracts, and all sorts of benefits that right now you can't get because you're negotiating to have a better healthcare plan. Labor gets more with the New York Health Act, not less. Now, it is true that unions have always led the charge, and they know the next big fight is healthcare. And that's why more and more unions are actually backing this bill. And I think I've been clear with labor leaders that my door is always open and will remain open. If I haven't been clear before, please accept this invitation. For anyone who wants to engage with us on making this bill better, but the bill needs to be done because we need to guarantee health care for every single New Yorker. Unions fought for health care. Now let's fight together so we can make it universal. Follow the campaign for New York Health and join me in the fight for cost-saving, universal health care for every New Yorker.
They're fighting for it in New York, they're fighting for it in Oregon, they're fighting for it in California. People around the nation are rallying together. As I like to say, it's almost like the Matrix. Americans have taken the red pill. They're willing to open their eyes to the truth that there can be a different system. It doesn't have to be the way it's always been, even if it's the USA in this highly capitalistic country. So they're fighting for it out there, they're fighting for it here. But before we go to our keynote speaker, Michael, who's going to tell you about what they're doing down in California and more, I really want to thank Nick Walden Poublon from coming to the stage. Now, he is our brand newly minted board member. Congratulations, Nick. But here's a story, and it's an inspiring story, because I was teaching a health policy class this winter, and it was during the first 100 days of the Trump administration, and my public health students, were like grad students, PhD students, they were all like fairly demoralized by the system and what was happening. And especially when we looked at the role of special interests in politics and everything, and just feeling kind of helpless that, people power, can't change anything because the system's rigged. But I think you'll be inspired by this few words from Nick about the way he got activated, how he worked together, and made some really big changes that had some real serious impact. So please put your hands together for Nick Walden Poublon.
Thank you very much. I'll be honest with you all. I did something that I always do when I come to do these things. I wrote a speech and then I left it sitting over there. And I'm just going to tell you the story of how it happened. I get asked a lot about why I care about healthcare and how I got activated. And that really can be summed up in a single day. I was 27 years old. I knew something was wrong. My body was not acting like it was supposed to. I was gaining weight. My hair was falling out. My thyroid had stopped working. I had developed diabetes. All these things were happening. I was 27 years old. And I had honestly, I'm ashamed to say, never paid attention to healthcare or healthcare policy before that day. And then they found the tumor at the base of my brain, and everything changed. It was my first week of grad school, and grad school was supposed to be this really great time for me. I had worked really hard to get through my undergrad, and I was a little older than I was supposed to be because life had gotten in the way, and I'd worked real jobs and worked really hard to get myself where I was supposed to be. And grad school was going to be this time that I was going to focus on me and learning. And then, the first week of school, of course, you get other plans. And I went to the university, and I'm lucky because they let me in the door. But I went to the university and I said, this isn't going to work. I can't go to school and be a patient at the same time with the health insurance plan that you are currently offering. And the university had a health insurance plan that was so crazy at the time. It was a basic health insurance plan that every student had to purchase. You just had to purchase it. You couldn't waive out of it. It was there.
And you had to use it first before you could use the supplemental plan that they also sold. So you had to use all the benefits of this basic plan, which was just really terrible. And then you could have access to this more supplemental plan that you paid an arm and a leg for. I think I paid $1,600 or $1,700 a term for it as a grad student in 2007. And it was worth it because my prescriptions alone were worth more than that a month at the time. And it had a secondary billing company, so you would literally you would pay up front the entire price for your prescriptions, and then send your bills off to Idaho, and wait 6 weeks for them to send you a check for you to get your money back. And I thought, this isn't gonna work. I'd have $2,000 out the door at any given time waiting for it to come back to me. And so the university said, well, you have to have an advisory board. I said, okay, fine, what do I have to do? And we found 7 students across campus who had health issues that were dissimilar to mine, but that were serious health issues. And we got together and we started asking questions. And we started helping in forums. And I don't know what came over me. I to this day, like, you get into this fight or flight mode, and I don't know where it came from, but it came from somewhere. And we met with the insurance company, and I brought them into a room about this size, with about as many students as are sitting here in the audience, and I said, your job is to listen. Do not speak. Students have things to say. It is not your time. You get to speak all the time. You get the final word. Today you are listening. And students came forward and talked about how they were putting off reproductive care, how they were not getting help for their sleep apnea, how they were not getting dental care, how they were not. And a lot of times the sad thing is they had access to some of these things at the university, but the university wasn't doing a good enough job of letting people know that they were available. So people were putting off care that they had free access to across the street, but they just didn't know it. So we met with these insurance companies, we held them accountable, we asked them questions. This is where I learned about a little group called United Healthcare. And within 3 months of asking them questions and asking them why they did business the way they did, and why they were offering students this shell project that was just really awful, we fired United Health Insurance. And I don't tell this part of the story often, but I'll tell you because you're health people. They offered me a job afterwards. I didn't take it. They offered me a job. They offered me lots of things, actually. When we started getting activated, they said to me, Nick, you don't have to send your prescriptions to Idaho anymore. We'll go ahead and just give you your money back. And that was the day I decided they had to go, right? Because if you're gonna offer me a service that you can't offer to other students in order to get me to shut up so that we won't cause problems for you, then you are definitely not in business for the right reason. And so we fired that insurance company, and for the first time in many, many years at PSU, for 28,000 students, we negotiated healthcare on behalf of ourselves. We sat at the table, and we listened, and we met with students for weeks. We met with students about what they needed, what was not part of this plan, what was not gonna work, what was not working for them. And one other thing came along too that we sometimes don't talk about, that I will talk about a little bit today because it's Pride Month, but trans healthcare was a big issue. Our trans students were finding out that they had basically invalidated their terms of service. They couldn't get routine colonoscopies or heart checks or things like that because they had, by virtue of the fact that they were taking hormones, this is in 2007, but by virtue of the fact that they were taking hormones, they had voided their warranty, which made me sick. And so we went around and we went to people and we said, what is not being covered? What do we need to cover? And we went out there and we made sure that every one of those things got covered. And when we went and found a provider to provide our health insurance, they didn't have a trans health policy. So I sat down with them and we literally wrote it together, word for word, to make sure that people would have access to the healthcare that they needed. And when we finished, OHSU came over and said, hey, we have some students. They don't have a healthcare insurance plan. We've been buying a shell product too. And so they put all of their students on our health insurance plan as well. So we were helping more than 28,000 students at a time. The things I learned. Well, I learned about all the jargon. I'm currently the chair of the healthcare caucus for the Democratic Party of Oregon. Yes? And one of my big goals this next year is education, education, education. Because I think there's going to be so much jargon that comes up in the next couple of months as we talk about what gets cut and what doesn't get cut. And I think people don't know what that jargon means, unfortunately, outside of this room, maybe. I talk to people who say inexplicably that Medicare should be cut and then don't understand, or Medicaid should be cut and don't understand that they are on OHP.
How can you not understand that? I don't understand how that happens, but it happens, and it's not just happening here in Oregon, it's happening across the country. So the things I learned is that it shouldn't take starting an advisory board to get healthcare. It shouldn't take having to be a student and a patient and a chair. I was the chair of the advisory board, and an advisor to the university, and a negotiator for the insurance, and all those things in order to get care, in order to be able to just get through your day. We are told all the time that we can't have healthcare for all because it's too hard, it hasn't been done yet, it's too expensive. And what I hear when I hear that being said is that we haven't worked hard enough yet, that we haven't turned over every stone. And I think stories like mine are really important to hear when we're thinking about the future of healthcare policy in Oregon. But for the fact that I stood up and caused a lot of trouble at my university, I don't know where I would be or what I would be facing at the moment. And I still graduated with thousands and thousands and thousands of dollars of medical debt that I had to pay back. And that was with the health insurance plan that I negotiated. So it wasn't like I got off scot-free. I want to thank you all for the work that you do. I want to thank you for adding me to your board today. I'm really appreciative of that. I'm excited about the work that we're going to get to do in the next couple of years. And we're working with Valdez and Mary and other folks that I have gotten to know over the last couple of months. I just really appreciate all the work that you do and want you to know that we see you. And like I said, my goal is to go forward and educate. And Valdez, you can use the term, I'll let you, but go from being a patient that's at the table, go to being at the table from being on the table. It's a big thing when you're staring down the barrel of that gun to understand how health insurance policy works. So I appreciate it, and thank you, everyone.
Thank you so much for your story, Nick. That is so heartfelt and so amazing to hear that change can happen, right? When we put in the effort and we raise our voices up. And this next person who I'm going to introduce is a true champion for the work that we do. And I remember hearing Michael Lighty here a couple years in this very room and remember his speech very vividly. And it has stayed true to, helping my energy to stay in this movement. And I distinctly recall your comments and being here, and it's really exciting to have you back with us here today. So Michael Lighty has organized, he has advocated, and he developed healthcare policy nationally and in California for about 30 years. He's a founding fellow of the Sanders Institute. Michael Lighty was the director of the public policy at the California Nurses Association, National Nurses United, where he worked for about 25 years. He's currently the president of Healthy California Now, the single payer coalition in the Golden State, representing National Union of Healthcare Workers. I give you Michael Lighty.
All right. It is so great to be here. Thank you, Tony. Thank you, Valdez. Thank you, HCAO, the most kick-ass grassroots single-payer coalition in the country. Thank you so much. Now, it's great to be back in my hometown. It's a little harder to see that picture. I think it's about 20 years old. And particularly hard when you're walking by the Holt Center and you see Churchill High School class of 2025 when you're the class of 1978. Okay, things have changed. This venue, the United Methodist Church, had actually played a significant role in a couple of instances for me personally. One was when I was in high school. A coach that I had for touch football, if you remember that, passed away, and he was in his 30s maybe, maybe in his late 20s, and I remember vividly going to that funeral. But what was kind of life-changing about that experience was that we had two coaches, and the other coach was there. And I realized at that moment in interacting with him that he's gay too. So it was a realization as a teenager, oh yeah, the light bulb went off. That was a profound moment. And the second one was when we had a memorial service for my grandmother here at the church. And I think I might get emotional. Anyway, she was, you know how your grandmother sometimes plays just the most wonderful and loving role in your life. And so that was my experience with my Nana. And to be back in this venue obviously has brought something up. But what I was reminded when Nick was speaking is that our movement starts with the experience of patients, starts with patient stories. My grandmother had diabetes from the age 50 until she passed away at 85. And she ended up passing away from liver cancer. And I too am diabetic. And that experience of her, I mean, she kind of showed me the way, you know, to how to live with dignity and vibrancy and love with that disease. So what I wanted to talk about today, I want to start with some patient stories. I want to talk about the effectiveness of what you all are doing as a political strategy. And I want to talk about the big picture, because we're not just healthcare activists. We know what's going on with the world. We know what this administration's doing to our country. And we feel it every day, and sometimes we can't sleep at night because of what they're doing. And so our work is integrally related to that fight against, I guess there are a lot of ways to say that, and we'll get to it. But from the time that I left Eugene, I've learned a few things, maybe. Experienced the joys of collective struggle, and sadly, really, for many of us in this room, it's been a period of right-wing ascendancy, right? I mean, we've had periods, obviously, better than others, but honestly, what we call neoliberalism, and essentially the privatization and deregulation and expansion of corporate power, economic inequality, and the fundamental racism and white supremacy that characterizes society. I live in Oakland now. The Black Panthers in 1965 were fighting for the same thing in terms of police violence that we've been dealing with more prominently, obviously, but always during that time, but more prominently since 2020 and the rise of the Black Lives Movement prior to that. So you get this feeling like, my God, when is it going to change? And it turns out that our struggle for healthcare justice is at the center of how it's going to change. Because as Nick and others have said, this is the most personal, intimate, public policy issue that we experience. This is where all of that corporate control and corporate power and inequality and racism comes down to us, to our bodies, to our health, our ability to live in this world. And so we are at the center then, because of that experience, of fighting back. That's right. So let me just... So really what we're experiencing is this kind of politics of resentment and revenge. It's consuming our country. And we must offer an alternative vision to that. And well, as I say, I want to start with stories because really this is where I call it the rapacious, murderous healthcare industry affects us directly and causes pain and suffering every day. Right? And we must free ourselves of the profit-making executives and the companies that put their wealth above our health. That's our challenge. So to talk about these stories, I want to, since I brought up, 1978 and 1980, I want to paraphrase our old nemesis, Ronald Reagan. If you remember what he said about government. So I have a reframe. The scariest words in the English language are, I'm from an health insurance company, and I'm here to help. Watch out, because it's not going to be good. So in the U.S. healthcare mess, patients confront so much dysfunction that if we didn't get one of those unexplainable explanation of benefits, you know, those EOBs, if we didn't get one of those, we wouldn't even know what kind of care we might be getting. I mean, it's indecipherable, right? And really no state is better than any other in terms of making sure that patients receive life-saving care. It's really across the board. And the stories we've heard today, you know, we hear all over the country. And honestly, most patients worry about out-of-pocket costs, right? That the barrier to get care. I don't think people realize that in no other country do you have to pay before you get health care at the point of service. Where you go into a clinic anywhere else in the world, you get health care. You go into a hospital here and you pay an insurance premium. Oh, and then you pay your copay. And maybe they even take your deductible. Then they'll see you. Now, you may or may not get care that you need, because as the doctors here can tell us, there's a whole set of standardized protocols that the doctors and the nurses must practice under. And they're not really looking at you as a patient. They've got a whole standardized data set algorithm that says, oh, for that condition, we're going to give you this medication and this course of treatment. And by the way, you can't exceed that level of service, or we're going to have to, reauthorize it. So it's almost a charade. It's not the fault of the providers. It is, as we heard earlier, it is the system. And it's a system designed to limit care. It is not a healthcare system. It's a profit-making system that wants to limit your access to care. Now, as these decisions have already been made in many cases, what we also find is that they're made in the way that denies care directly. That actually care denials are an epidemic in this country. And that is what, that's really, I think, the primary experience. Why, Nick was talking about United Healthcare. Why is United Healthcare an object of derision, right? Well, they're an object of scorn because, the elected officials found out they use an algorithm to decide what claims to pay. Not the denials of claims per se did the shareholders care about. They just cared about the optics of an algorithm making the decision. So that tells you all you need to know. So what patients often do is they turn to public pressure campaigns. So I work with this campaign, Care Over Cost, People's Action Institute. And if you haven't seen it, I recommend going to that website, careovercost.org. And it gathers patient stories, and they have a large network of people who are activated. And before United Health really rose to prominence, for some reason, they were at their headquarters in Minnesota doing civil disobedience over claims denials. And that kind of confrontation directly with the corporate overlords is what it takes. But there's this one case, Jen, a former Republican legislator in EMT, found herself locked in a familiar cycle of denials that United Health is famous for. Her pain treatment following cancer care was denied. And only a massive public pressure campaign got United Health to relent. Jen went to the headquarters as part of that action and spoke to their people. And see, these are those nasty algorithms. They're everywhere. But the problem Jen has is that, they got eventually those infusions approved, but every time she has to get one, they reserve the right to authorize it or not. So a massive public pressure campaign, arrests at the corporate headquarters. Okay, we'll give you the infusion. Oh, but by the way, you have to keep asking us for it. Who's making the medical decisions? The legislator was talking about it. Corporate practice of medicine, that's what we got. That's exactly what we got. Now, if you think about it, this is why these stories are so important. The pain from cancer, And this is what she has to deal with. This is our pain. This is why we act collectively, because no individual should bear that burden by themselves. Now, United Health keeps doing this. Jen is in New Hampshire. Oregon, obviously, you have your own stories, a couple of them. Nick, profound experience. So the group Healthcare Now collects these stories, Voices of U.S. Healthcare, another great place to go to get this background. A mother from Oregon wrote into that Voices of U.S. Healthcare. I'm writing on behalf of my son who has multiple disabilities as well as schizophrenia. He had major mental health and behavioral crises as a child and teen, and in my state, there are less than 200 acute inpatient pediatric psychiatric beds available for the entire state. Some of you may know that. This results in children staying for days in ill-equipped and traumatizing emergency rooms and being sent home to cope with acute crisis situations without support. Now, we've long ignored mental health care needs, right? We've got some legislation that says we have parity. If there are any mental health providers here, I think we can all agree there is no parity, right? And it's not just mental health, it's obviously things like eyes, ears, teeth, right? We don't get those covered adequately, as one of our panelists was talking about, that root canal she had to have in the backyard. And so this mother with the child in mental health crisis says that I have consistently had to struggle with insurance companies to cover his psychiatrist visit so he can have his medication for his schizophrenia, because finding competent care is so difficult that we have to drive to a neighboring state to get a psychiatrist that can treat him. Wow. Okay. A schizophrenic child can't get mental health services in Oregon, where she lives. Now, another patient from Oregon, Hyun, is a teacher. His struggle to cover himself, I think, is similar to teachers all over the state and nation. I have less coverage now because I'm working half-time, but as a full-time teacher, my total premium was over $18,000 annually, with 7% coming out of my paycheck. The first thing the district tried to do when bargaining our new contract was to cap their contribution to health benefits. Sound familiar? Even with such expensive benefits, I maxed out on dental coverage with one filling and one root canal, for which I still had to pay over $1,000 out of pocket in deductibles. I don't have dental or vision benefits, and my health insurance does not cover quite as much, but the premium the school district pays is still about $8,000 a year. The cost of adding a dental will be an extra $600 a month. This is money that is lost from our paychecks and from funding that should be helping our students directly. And I often say that to teachers, that teachers and education has the most stake in healthcare reform, because the public dollars that are saved under a single-payer system are going to go into education. We know that. And the school districts are spending these tens of millions of dollars on insurance companies. And keep in mind what's going on here. You all know. It's a wealth transfer. The union sits down with, in this case, the school district, and they agree how much the health care is going to cost, or how much the school district is going to pay, and they just give it to the insurance company. That's all it is, just a wealth transfer. And every private employer does the same thing. Every union bargaining session is essentially that. How much of our wages are we not going to get so that we can maintain our health benefits and give this money to the profit-making insurance companies? That's our healthcare system. And the result is these patients who can't get the care they need. And I really, obviously all of us support the Affordable Care Act and Medicaid because it's better than the alternative. But keep in mind, coverage is not care, right? Coverage is not care. And these are people with insurance. who can't get the care they need for themselves or their child. So your fellow Oregonians are suffering. The mother fights for her child, the teacher fights for his students, patients lose doctors and providers as contract changes. That's really why we're here. That's why we can't wait for anyone else to step up. That's why we have to step up. And until all Oregonians and all Americans are covered and guaranteed care, we cannot stop, we cannot rest. And so what I so admire about HCAO is you've made a very tough and strategic choice to actually do the nitty-gritty work to get us from here to there. Yeah, we all want to pass a bill and say, yeah, the system's changed. But it doesn't work that way. I don't necessarily agree it takes forever, you know, as the legislator was kind of suggesting, but I do think that it requires a systematic, sequential approach to winning. And what passing the constitutional healthcare is a human right, very key political victory. Passing the legislation, engaging with the task force, getting a good task force report, establishing the Universal Health Plan Governing Board. These are the kinds of things that our movement for too long has not taken seriously enough. Because look, we got the moral imperative on our side. We know single payer saves boatloads of money, right? We know that our policy program is far superior to this present system of denials and narrow networks, pre-authorizations, algorithm-driven care. We know that, but what we haven't resolved and what we haven't done as effectively is win the political fight, because we haven't won yet. And we haven't won yet because we haven't won the political fight. Popular opinion is overwhelmingly on our side. And this is where we can't divorce ourselves, obviously, from the present political system that is totally dominated by corporate money. So it takes this kind of sequential, strategic approach to overcome those barriers and get us into a position where we can actually overcome the money and the momentum. I hear Democrats all the time, as Nick said, oh, it's not viable. Well, we can't do it. My God, what did President Trump just not do? He ripped up the Constitution. He ripped up everything in the federal government. He didn't say, oh, I don't think that's politically viable. He just did it. And it's time for the Democrats to have that kind of political will. So do it. And the difference is, what we want to do is popular. And we're not burning down the country, we're building it up. We're saving lives, not killing people. And yet, there's not the political will to do that? Are you kidding me? Anyway, I wanted to insert another adjective there. Okay, we're in a church. So we have the process in California is similar to the process you're doing in Oregon. But we don't have the kind of resources, the policy development resources and the community engagement resources that the state has funded here to the governance board. And that's a big difference. So the coalition that I lead, Healthy California Now, is going to take on that task. And we had a Healthy California for All commission, like your task force. They produced a report. We then used that to pass our SB 770 and establish this process that was two-part. One track, okay, let's develop negotiating priorities for the federal government to get the necessary waivers, right, to get the federal money into our universal program. So that was the main purpose of the bill. The other purpose was, what can California do on its own? Right? As you can imagine, the federal piece isn't happening. And I think we're both in the same boat there, that we're probably not going to have that opportunity to really engage with the Federal Health and Human Service Agency until 2029. That's just the reality. But there's a lot we can do in the meantime. And so what we want to do in California is take this white paper we're going to get from the UCLA Center for Health Policy Research. It's got some system design proposals in it. When that gets publicly released, do the community engagement around the state. What's your vision for a healthcare system? What do you need in a healthcare system? We saw some polling on that. Of course, it's not going to surprise this room. The costs were the #1 barrier to care. But what was almost as high, and for some people more intense? Cultural barriers to care. The Medi-Cal or Medicaid population in California suffers tremendously from culturally incompetent care. So that turns out to be a huge factor. So we want to go around to those healthcare clinics that are in the rural parts of the state, in other parts of the state, and find out when we talk about system transformation, what does it really mean? And we hope to have also an impact on the next governor of California, who will be elected in 2026, and have a proposal on the table for them, what California can do on its own until we get the necessary waivers. And we do this in the context of the massive withdrawal of federal support, and it's criminal. And what we got to be very clear about is that this suffering is it will be a direct result of what we call the MAGA murder budget, right? That's what it is. It's not a big, beautiful bill. It's literally going to kill people. 13 million people are going to lose coverage nationwide. But what it also is that it's a reflection of the historic segregation between Medicaid and Medicare. And Medicaid was segregated from the program covering seniors in order to satisfy the racists in the from the South, right? From the Dixiecrats, right? And that is continuing, because this attack on Medicaid has currency, not because most of the folks who get Medicaid are BIPOC folks, but because it's perceived that they are, and they use racism to say, yeah, it's okay.
We're not going to insure them.
No, we're not going to insure them, exactly. And then they say, oh, we're not cutting benefits, right? Well, guess what? When you make it harder for people to be in a program, and 13 million people lose the coverage of that program, you're cutting benefits, sorry to say. Now, what we need to understand is that there are Democrats who are okay with work requirements under Medicaid. And this is a fundamental flaw. And when we talk about the big picture, it's really important to understand this. Because part of the reason, beyond racism and wanting to give tax cuts to billionaires, the other dynamic is these Republicans think Medicaid's a welfare program, not a health care program. So of course, a welfare program, you gotta work. Well, yeah, it turns out there's only 7% of people who get Medicaid coverage who could work who aren't at any given time. But really what this work requirement is a job loss penalty. Because when you become unemployed, you qualify for Medicaid. But hold it, you can't qualify for Medicaid unless you're working. But I just lost my job. That's a job loss penalty. If you lose your job in an economy that, by the way, President Trump is trying to tank, right, you're going to lose your health care coverage. Oh, but it's not health care, it's welfare. No, it's actually health care coverage. And let me just remind them that 30% of their voters get benefits from this program. So good luck with that. Now, when we talk about responding to this disaster, right, we have to talk about how we win politically, but we also have to talk about an alternative vision and program. And we can't cede the turf to them. They want to blame immigrants for virtually everything, right? The housing crisis, so forth. And that politics of resentment is a huge foundation for their politics. Our politics has to be of inclusion. We are all in this together. That we have to directly confront that. It is not the immigrant who is taking your job. It is the profit-making corporation who has ripped off this country, kept your wages down, and is making tons of money for their shareholders. That's who the problem is. And we have to operate in a way that builds broader alliances. And I think that's the other strength of what is potentially going to happen under the governing board, is that there's going to be an opportunity, because the silver lining of our not getting engaged with the federal government as quickly as we wanted to is that we have time to listen. And listening is the foundation of organizing. As the panel was saying, let's talk to folks who have been excluded from this process. Let's hear what, as I mentioned, these folks at federally qualified health centers are actually experiencing. What do people need? And let's talk to our skeptics and opponents. Let's talk to union members and educate them. Let's actually listen to these people. And we have the time to do that. That's the beautiful thing. We do have time. And as organizers, we have to take that seriously. And I think this legislation that's attacking consolidation and is really important, because consolidations mean less care. Period. No debate. That's what happens. Because the reason they're consolidating is so that they can provide less care. So they can close hospitals in Bend or Corvallis. So that Eugene loses the hospital where I was born in, and okay, we have to go to Springfield. That's not a disaster. But it is still reflective of what's going on in healthcare. And the only reason these decisions are made is because of profit. That is it, right? I mean, it's like, oh yeah, we're gonna like be more efficient. I mean, make more money. Just want to be clear on that. And so, fighting those consolidations, understanding who's most affected and how they're affected, gathering and telling these stories, listening and organizing new constituencies. Obviously, rural Oregon is in crisis, is in a healthcare crisis, and it has been for a long time. And same in California, and we can't ignore that. And politically,
But Cliff Bentz can ignore that.
yeah, exactly. Well, that's the point. Exactly. This guy's gonna like, yeah, I don't know. I mean, yeah, I guess, if you're a Republican who's for lower taxes, you can get reelected no matter what else you do. I guess that's it. But honestly, it's a crime. It is honestly a crime. And I don't, but I actually think there's an opportunity to organize these constituents on this question. If you're getting Medicaid and you lose it, if you lose your job and can't get on the Oregon Health Plan, that's a big deal. And I think
40% of Cliff Bentz's constituents are on Oregon Health.
yeah, we have one district in California, also represented by a Republican in Bakersfield, Valadeo, where I think the number is 43%. Right? So we're really at an inflection point. And part of that inflection point came from, sadly, the atrocious murder of the United Healthcare executive. Right? But it turns out that 67% of Americans held United Health partially responsible for his murder. Yeah. Imagine that. And your executive gets murdered on the streets of New York, and people think it's your fault. Well, that's a revelation. I'm going to say people hate insurance companies. Right? And that is a huge opening for us. The Democrats can say all they want about, it's not viable to, switch from private insurance to Medicare for all. Oh, so you're defending United Health. So you like them. Oh, you want them running Medicare through the Medicare Advantage program. You're all for that? That's what you think we should do? We should continue to provide tax subsidies to the insurance companies so they can deny us care and have some algorithm tell our doctor how to treat us? That's the system you're defending? I think we got to call them on that. And I think there's some opportunities we have. To me, one of the most threatening things to corporate health care are doctors unionizing. And who said earlier today that doctors are increasingly employees, right? That private practices are gone, practices are merging. They're workers. Yep. Sorry to break it to the AMA, right? But that's what's happened because of the health system you supported. This is the logical end. And now we're workers and we're in this together, and just like the CIR, the Committee on Interns and Residents, is organizing their constituency, doctors are starting to unionize. That is something we should support, we should encourage, and why not take the 60th anniversary of Medicare to highlight the Medicaid fight and the history of Medicare, which labor was instrumental in creating, and using that as an opportunity to encourage unionization of doctors and the engagement of other union members. Now, because ultimately, this generation, I think, this generation of providers wants to reclaim professional clinical decision making. They want to take it back from the insurance company bureaucrats, the algorithms, and let's not forget the private equity bottom feeders. Right? Private equity is a huge part of this problem, but it's really just kind of the grossest example, right, of corporate healthcare, because they don't hide it. They're just like, yeah, we're buying this and we're going to like shut half of it down and we're going to take the money and run, right? Okay, that's private equity. But really, it's just a version of what's going on overall. And I think if we actually engage with people, you talk to small business owners, they know this, right? You talk to folks in rural Oregon, Ben's constituents, they know this. But they don't feel that they can have an impact, they can create change, that they just have to, you know, take it. And we're here to help them understand that they don't have to take it, right? That's our task as organizers. We have to tell them there is an alternative to this world of cruelty and resentment and hatred and racism and corporate control. There is a vision and alternative. That's what we bring to this fight. And, you know, speaking of this fight, I think it's time for Oregon's senior senator to get up and lead. Now, Senator Walden he's the most powerful healthcare Democrat in the Senate, right? And he has got to step up. Now,
He has said to us it's too difficult.
of course it's too difficult. Yeah.
He said it to my face. Oh, it's just too hard.
Let me ask you.
Give me a freaking break.
Exactly.
That is such
Exactly.
a BS. They do difficult things all the time. He has a full paid staff that none of us have. Oh my God. Don't get me started.
Oh no, let's get you started. Let's get you started. Yes, here we go. Now, it turns out, you know, they want to increase the defense budget by a couple $100 billion. They want to give ICE $170 billion. You know, I never heard them ask, how do you pay for it? How do you pay for it? Oh, for universal health care. Oh, how do you pay for it? Okay, got it. Now the Democrats are complaining about how the Republicans are ignoring their constituents. Right? How many times have we heard that in the last couple months? Oh, all this stuff's unpopular. Well, guess what, Senator Wyden? Oregonians want single payer. So listen to us. That's the culture. Now, as we talk about that alternative vision, we have to call out the corporate consolidation, the rising inequality, the attacks on public health and essential human services. And as the oligarchs and authoritarians menace our society, you all here are helping lead a movement based in caring, compassion, and community. Those values are the alternative to what's going on in our country. Those values can show people that, yeah, that kindness and decency are still worth fighting for. Amen. And that vision, those values, can sustain us as well. And in the world we want, People take care of each other. That's what we do. We take care of each other as human beings. And we face the tyrants and the billionaires who want to burn down the planet, and we say, hell no! We will never stop fighting for healthcare justice. Thank you very much.
Michael Lighty! All right, Michael, if you could sit, we're going to do a little bit of a little Q&A. So we're going to give like maybe 10 minutes for some questions, because a lot of you probably have some great ideas in the room. And once I see you over here, were we going to do a mic stand that people could come to? That way I don't have to like try. Last year I got kind of criticized for only seeing one side of the room. So we're thinking maybe people could come up to a mic stand, or we could go to them or something. But so yeah, so come up to Tony here and get in line if you have a question, and we'll just go in order, first come, first serve. And I'll give the microphone back to Michael. So we'll go for about 10 minutes.
Michael, I'm very excited about some of the ideas you have. I'm just wondering, as part of the overall, how everybody feels about the Maha movement and where that might take us, because there's a lot of changes coming down the pike, and they will be good for many of us. So how do you feel about that?
I think it's always a good idea to try to co-opt your opponents. To find out how to kind of what they say, jujitsu, right? Oh, make America healthy again, like guaranteeing health care to everybody? Yeah, why not? I mean, I know it's not part of it exactly, but what I'm saying is I think we need to, if that's the frame, let's try to figure out how to use the frame, right? And if they want to eliminate toxic chemicals and food additives, that's a positive thing. There's no reason, we don't have to be the, we don't have to be nasty like they are, right? We can try to find some common ground with people. I don't, and I don't obviously subscribe to their position on vaccines, for example, but we have to understand where people are coming from. And that's what I mean by listening. Why are you attracted to that program? How can our program address those motivations, right, that take you there? And so that's the kind of dynamic I think we need to get into, is be different from them. I don't think we have taken that advantage of that yet. I think that's right. I think that's right. And so it would be up to us to figure out, how to do that.
So I was wondering, in our Poublon organizing, in the Poublon for organizing, if in comparison with other well-off nations and their health care, something we can talk about now. They used to say, things like if you were to get health care in Canada, you have to wait to implement to have a knee replacement, you have to wait for that. Well, now people can't get that, or it's not available. I'm a retired primary physician, and I worked in New Zealand in an accident emergency area. And I have to say it was very fresh air back in the day, even now, of course, it's even more comparison. So I just wonder if people at large are aware that other well-off countries have a completely different system that tends to work. And then we could use that as an organizing tool.
Right. I mean, I've gone back and forth on this question for, over 30 years. Because I started, one of the first projects I did for healthcare organizing was to bring Canadian doctors and nurses to the US in 1991 in order to influence the debate over what became Hillary Care. And we thought that was a pretty important, organizing approach. But, the kind of recent public opinion research seems to show that people don't care. And that it's very tough to win the argument over Canada because the anecdotal stuff resonates with people. And so if you have a cousin who had to wait for hip replacement, in Toronto, that's it. you're convinced it's bad, right? So I think we have to be cognizant of that. I think there are some things we can talk about, though. And I think the one thing we can talk about is what I mentioned. You have to pay at the time you get care here. That's not true for anybody else in countries like ours. I think you can talk about things like that. Not a specific, country, but a practice. People just accept the fact that you have to shell out this money and everyone in the waiting room can hear your negotiation over payment. It's wrong, right? It's just wrong. And I think people at a kind of visceral level don't like it. And so you say, yeah, go to the doctor, get care, you've already paid for it. I think we can talk about that. That's what the rest of the world in countries like us do. But I would be very wary of saying Canada's this or, the UK is the most socialized system in the world. Until it's been defunded, it was the best. You could never convince anyone of that, right? But we could talk about the VA. People have vilified the VA, but the VA provides some of the highest standard of care in the country. And in fact, veterans are very happy with the VA. They're unhappy, right, there you go. They're unhappy with what's being done to the VA, but my father is here. I didn't actually get to introduce him, but he's here, and he benefited greatly from VA care. So I think there are things we can talk about.
About co-opting. Some people here may be familiar with a website, Your Local Epidemiologist.
Yeah, I love that.
And in the most recent message, the facilitator of that has been having dialogues between scientists, doctors, and MAHA activists. But she also cautioned that while there's a grassroots sincerity to listen to, RFK Jr. is not sincere, not a good faith advocate, and it's more than just anti-vax. He's also a cholesterol denier and doesn't believe that germs cause disease. This is not an exaggeration. And we need a lot of education about what is and what is not healthcare. We have a lot of cracks in Eugene that aren't from ducks.
That's a good one. Yes, I agree. I think, but you see, that's what I was talking about earlier. It's a matter of reaching the grassroots folks. RFK, that's just medieval, right? His views are like, wow, okay. It's like some kind of, doctrine, that's not based in reality or science. And we have to push back on the anti-science piece. And I think we have to engage with folks who are attracted to that. I don't think we can write them off, but we do have to delegitimize RFK Jr. He does a pretty good job at doing that himself. Brain worm and all that.
All right.
On that note?
We're not ending. We're not ending on brain worms. There might be some Star Trek 2 fans there, or Star Trek 3. Michael, really quick. We always do an annual kind of call to action, kind of the pitch. So that's coming up, y'all. Get your envelopes ready. But it was something that we talked about when we were having one of our evening conversations in the lead up to this. That really resonated with me, and I'm in the middle of this movement just like everybody else. You said Oregon has a lot of things going for it in terms of strategic competitive edge to actually get this done in terms of our legislative makeup and our size and rurality and all these things. Could you just share a little bit about what you shared with me about why you see as Oregon having a lot of kind of unique advantages?
I should have done that in my speech. But thank you, Valdez. Oregon, first of all, you're farther along than any other state. You've essentially gotten the state You've gotten the state legislature to say, we want to do single payer. Figure out how to do it. That's the position of the Oregon legislature. And the governor signed that bill, right? And you put it in the Constitution that healthcare is a human right. Other states haven't done that, okay? You're not a small state like Vermont, which has real challenges to do state single payer. State single payer is not easy. Charlie Swanson can tell you about that. I mean, it is not easy, all right? And yet, you have to be big enough to make it possible. You know, you have to have big enough budget, big enough population. And Oregon is in that, has crossed that threshold. But it's small enough where you really could run a grassroots campaign, right? You could really, see, I think organizations are really essential to this fight. And so you've got some of the leading organizations in the state on your side with HCAO, right? And that organization base is the vehicle through which to reach their membership and to build the grassroots campaign. I don't think you can just do, I'm not a proponent of, you know, the digital organizing, you know, it's just gonna do it, right? I think it has to be done, that's good, but it also has to be done to organizations, because organizations have the respect of their membership. And you have that, again here. We were talking at the labor table. Yeah, it's frustrating, the Oregon labor movement, but I gotta tell you, it's better than any other place I've seen in terms of its engagement and support for this, okay? So there's a lot to build on with the labor movement in Oregon. It's very significant. I mean, you know, you have nurses, the teachers, public workers, and there are others, right? And there are other opportunities. We were talking about Unite Here. Unite Here is very interested in a collaborative multi-state strategy. We're having those discussions between Oregon and California about how we can coordinate. We're on a similar path. I literally, in your brochure, you have that roadmap to, you know, guaranteed health care. We literally did the same thing for California. It looks almost the same. So we're on this path together. Maybe we can bring Washington State on, right? And we all have to go to the ballot. But if we go to the ballot at the same time, that's a lot tougher for the industry. And in Oregon, yeah, you know, we haven't been able to pass ballot measures, and in California and Oregon, we've gotten creamed on them. But now you've really built the institutional base and the political base that is far superior than what we've had before. And if you just take these next steps, this organizing project to listen, to, you know, deepen that organizational engagement with the coalition, to really get labor on board so they fund the campaign. But they only fund the campaign if their members and their leaders are convinced it can win, and you're laying the groundwork for that, because you've got a solid policy proposal that is very credible. So it's an array, it's quite an array of advantages you have here. And you know, the state south of you, 40 million people, we got a tough road. We got a tough road. But we're not going to give up either. And we're in this together. And once again, we are in this together. Well, we want to get Washington State involved too. They're a little bit behind the process. They haven't had a commission report or a task force report like we've had, right? So, and they're working on it. But we got to get them along. And let me just say one more thing. Having the governor support is decisive. Okay, and you've gotten just enough support from the governor, right, to keep it moving. We had a governor who ran on single payer, so we were able to pass SB 770 with his signature. That is the most advanced single payer bill that has been enacted in California, for sure. I mean, others haven't been enacted. That one actually was, right? And we called it unified financing, and we made certain, you know, I would say rhetorical compromises. But the governor signed it. And without the governor's support, it wouldn't have happened, period. Same in federally. Without the president leading on this, it is not going to happen. So we have to create that political climate for the president to lead. And I forgot to mention Dr. Abdul El-Sayed. I did hosted a fundraising event for him last week in Emeryville. Raised a good chunk of money, had a bunch of PNHP docs in the room. There may be a relationship between those two things. And what Abdul said was, as a Medicare for All champion, if he's elected in 2026, that sets the table for 2028 in a swing state in a massively effective way for our issue. Imagine a Medicare for All public health doc going to the Senate, having just won a swing state in Michigan. Well, all of a sudden, I think Governor Whitmer and Pete Buttigieg are going to have to start talking about Medicare for all.
Yeah.
So let's understand politically again the kind of difference a candidacy like that can make.
Thank you, Michael, so much. I was just sharing with Valdez. I recall this, and I remember taking on notes from May 2018 recording of your speech that year. So it stands with me, and I recall listening to it over and over. So really appreciate your words of wisdom.
So without further ado, I am going to go ahead and pass it off to the moderator for this afternoon panel on Universal Health Plan Governance Board, Collin Stackhouse. Thank you, Collin.
Yeah. Hello. 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 And you have a board with all the committees when you're... Yeah, great. Actually, Simon, can you go to the next slide, which shows the different committees? So you've heard a lot about them. The Universal Health Plan Governance Board is the group of 9 humans, not artificial intelligence, the group of 9 humans who are responsible with completing the plan for Oregon's transition to universal health care and submitting that plan back to the legislature. They're obligated by law to do that by September 15th, 2026. And all signs point to yes, that timing still will happen. They will complete their work, but they will not at all be doing it alone. So we're happy to have this slide which sort of indicates the 8 members of the board that are currently present and also the 1 spot at the far end. There is an open board position for somebody with experience in healthcare specifically. There's 2 different kinds of Universal Health Plan Governance Board members, and there's a slot open for somebody with experience in healthcare. So if you know somebody who might be a good companion for these 3 people to my left. To my right is another member of Healthcare for All Oregon, Tony Germann. You've heard him speak. He and I are grateful to be sitting at this table right now because we're excited about the work of these 9 people, but we are both on different subcommittees. So Tony is on the plan design subcommittee. I'm on the communications, or the community engagement and communications subcommittee with Amy Fellows, my committee chair. So we're grateful to sort of moderate this discussion, but really these 3 and the 6 others that are working with them are the stars of the show for the next year and a half. They are what all of you need to be paying attention to. Their words, their actions, and their final product is going to shape the future of healthcare in Oregon, which is no small feat. So can you have a round of applause for the Universal Health Plan Governance Board? Thank you. So from left to right, I'll introduce them, then I'll hand the mic over to Amy. We have Amy Fellows, keep on clapping. Dr. Chunhuei. And most of you know Mary Lou Hennrich, who does double duty. Round of applause for Mary Lou. She does double duty as a member of the Healthcare for All Oregon Board and also serves on the Universal Health Plan Governance Board as one of their board members. So, yeah, if the 3 of you can give your introductions and if you want a synopsis of where we're at and where we're going.
Hi, can you hear me?
Yep.
All right, so I'm Amy Fellows, and my why for joining the board was to make sure there was somebody with a disability justice lens. I'm the parent of a disabled teen who is on Oregon Health Plan through Developmental Disability Services. I myself purchased my own insurance through the exchange, so I have kind of a little bit different lens than some other folks. I actually woke up this morning with a text from a good friend sending me her denial letter from her insurance company, so that was kind of ironic to wake up to this morning before coming here. Should we just do intros and then? Yeah. Okay. Yeah. All right, I'm going to pass it on and we'll talk more about the board in a moment.
Good afternoon. My name is Chunhuei. I started volunteer to promote universal health care both in Oregon and in the country since 1997. And some of you might remember the pioneer, a wonderful lady who recruited me in the first place, Miss Betty Johnson. Yeah. So I have been working to promote universal healthcare both in Oregon and in the country since then. And over the time, I testify in front of the legislature 3 times. And I'm glad I have this opportunity to serve on the board. And I'm currently a professor at Oregon State University in its Health Management Policy Program and Global Health Program. And one of my expertise, which I contribute to the board, is health system finance. Thank you.
Well, I'm the newest member to the board because the one person resigned from the board, and I was urged and decided, okay, I might as well put my name in, and voila, here I am. So I started in March, was my first meeting. And my background, I started as a public health nurse, Multnomah County Deputy Director. I really believed that we could incrementally fix things. I spent 30 years of my life trying to do things. We became Multnomah County a federally qualified health center, just a lot of things, and I really did believe. And then I became the first person to be the CEO of Care Oregon, which is now the biggest OHP CCO in the state. Yeah, anyway, they're the biggest in the state. But I have really been saddened, disappointed, frustrated, angry that it cannot be fixed one more little piece at a time. My new mantra is no more Band-Aids.
Sorry.
It's all good, we're flexible. Thank you for those introductions. One of my questions that I shared before is, could you give a synopsis of the path so far in 60 seconds or less? I won't hold you to that, but I want to see if it's even possible to do a quick synopsis and then do the synopsis that you want to do.
My 60-second, I guess, would be that the board is basically has gotten the baton from the task force that predated us, and we are currently in the phase of plan creation, and then there will be a next phase. So.
That's great. And actually, I think call and response seems fine. I heard somebody say, what's the next phase?
The next phase will be directed by the legislature, because our job is to turn in a plan by September 2026, like you heard, and it'll be a comment, and then we'll need all of you to help support us, making sure that the legislators hear that they want to move forward with the plan, and I think, yeah.
Do you want to do the piece that you mentioned before, or do you want to pass it out for 60 seconds for Chunhuei?
Let's do 60 seconds.
Yeah, okay. All right, Chunhuei, 60 seconds on the clock.
My 60 seconds will be to let you know, to share with you that where we are now in terms of we're getting into the detail of 4 major segments of the universal health plan. Finance, where we get money, mainly taxations. And then the benefit, what will be covered, and how we, also payment, how we are going to pay providers, physicians, clinics, hospitals. And the last part is eligibility. So each of those segments include lots of detail. That's what the current board is working on.
I guess I want to respond to a lot of you in this room who have given me frustrations, told me frustrations about how slowly they feel the board has moved, that they don't really know that we're gonna make it, what's happening. And coming in as an outsider in March, I really contemplated that. But when you think about, there was nothing when this law put this into being, and to create kind of a mini state agency within the state government has taken time. And there were some missteps, there were some pieces that just didn't flow, but I feel like maybe they and now we have moved slow in order to move fast. And I think we're at that point now where we really are, when we talk about the committees and what's going on, I think that hopefully in a few months you'll all be going, oh, okay, they aren't just twiddling their thumbs, okay? So I acknowledge that I've heard you, okay?
So I was just going to do a really quick overview of the 4 committees and kind of current work as of last month, this month, the kind of bullet points. So there are 4 committees, and that includes, so starting with plan design and expenditures, which Antonio's on. So you might be able to fill in. But the current work is creating a eligibility straw proposal and researching and revising that. A behavioral health straw proposal, which the board approved at our last, or the meeting before our strategic planning meeting. A long-term support and services straw proposal, which a subcommittee is being developed, and I'm interested in being a part of that one. Provider reimbursement, which we're working with Health Management Associates, which is a national consulting firm. And a subcommittee is in development for the provider reimbursement portion. Then finance and revenue, just started working with Eco Northwest, a consulting group. Started working with the committee, and then the committee is interested in administrative cost issues, and that's one of the big focuses. And then these 2 are on that committee, so I don't know if they want to mention more. Okay, they'll talk. And then the operations committee is looking at public corporation straw proposals. So like what kind of entity will this be when we have the plan and we're at that next step? Looking at federal waivers and working with health management associates who one of their expertise is Medicaid, and looking at what all the different states are doing, because we have Medicaid waivers and we will need CMS approval at some point to make this plan happen, so there's a lot of planning going into that. And the Treasury Fund straw proposal, which is being reviewed at the committee and is going to be sent to the board at, I think, the next meeting for final approval. And then I'm a co-chair of the Community Engagement and Communications Committee, and we have been working some with Diana Bianco from Artemis Consulting on the community engagement piece. And our community engagement is somewhat dictated by SB 1089 to the groups that are written into that law. So I know there's a lot of questions about how come we're not doing this broad public engagement at this point. And that is because we have limited resources and we are dictated by law to engage with employers, small and large, business organizations, small and large, healthcare providers, healthcare insurers, healthcare consumers, coordinated care organizations, community-based organizations, and disability-led organizations. So that will be the focus of our engagement. And last June, I saw Patty Wentz speak on a panel, and I, ever since then, was trying to get her involved in our work. And finally, contracts are happening, like as we speak, to bring Patty on to help us with strategic communications so that we are all using the same language. We're working on a style guide so that we are all using the same kind of language when we talk about the work of the board going forward.
Thank you for Amy for a very detailed summary of the current progress. And I'm just trying to fill in some other details, particularly on the finance part. Finance is a big part that our predecessors' task force didn't complete, so it left a lot of work for us. And that's also a very challenging and complex. When we talk about finance, it's about taxations. So again, the board, both the board and the committee has not come to a conclusion yet, but we are contemplating among all sources, 2 will be the most primary. Again, this is not final, this is what we are contemplating. One is a separate earmarked income tax specifically for the universal health plan. The other is payroll tax from the employer. And the payroll tax is largely to replace what a sizable Oregonians currently receive their private insurance benefit from employer. And we want to capture that part for the employer to continue to contribute. And again, how to do that is quite complicated. And the committee also has a contract with the consulting firm to help us. And the other complication is payment systems. And payment system has to be associated with the outcome, the qualities. But at the same time, it's also important, the payment system should be designed in such a way it not only promote quality, but also help control the costs. Because if we are not able to control the rising costs, even after we implemented the universal health plan, it will suffer a major obstacle. And people who objected to the universal health plan will be more than happy to see that as a stumbling block for the system. So how we can effectively control the costs will be a key task. And again, the board and committee are currently considering some options. And one of the options is to have the global budget for hospitals by region. And how we divide those regions is yet to be determined, and that's a detail. And potentially, to have only a global budget for hospital will be very difficult to control the whole cost. Because when you have a global budget for hospital, some hospitals are also connected with subsidiary clinics. So there will be potential shift in order to generate more revenues to shift some of the services to clinics. So one potential is to contemplate not just the global budget for hospital, but there can be a global budget for each sector. So when you have everything under global budget, that can effectively control the cost. And Taiwan implemented that for nearly 20 years, and that has been a very effective method of controlling the overall spendings. And I will stop here.
Well, I'm on the Finance and Revenue Committee now, and kind of getting up to speed. I think we need to recognize Charlie Swanson here, who has done amazing work on that committee. One of the things that we want to do is be sure to know where and how much money is currently being spent from every nook and cranny, and to see what that is, because that will give us some guide in terms of how much we need to raise from other taxation, because right now it's all these different ways. And it's a huge task. And you kind of go down this little alley and you go, oh dear, and over here. And so I think when people have been frustrated that it hasn't gone fast enough, or why don't we, I keep having people ask me, well, how much will it cost for me? And what kind of income tax am I gonna have to pay? And I'm really sorry, but we can't give you that answer yet. But we are moving that direction. I think the fact Echo Northwest, I say ECO, but they say Echo, it just started a contract to work with our committee, and I think also with the Eligibility and Benefits Committee too, maybe. Anyway, they came to our first meeting last month, and overall, I was personally impressed with their style, with their willingness to, at first it sounded like we're gonna start all over. And the committee had already done a bunch of work, especially the stuff that I referenced from Charlie, and it was like, wait a second. But they changed their plans because they listened to us, and so I think things are gonna move forward, and we'll have some expertise. They'll also be looking at impacts for the whole economy. What would this mean? There's just a lot of questions, and it is not simple, but we will get there, and we're committed to it, and I think we're getting the technical resources that we need to help us make those decisions. But I heard someone the other day say, well, I was looking at the payroll tax, and how much would I pay it? I said, wait, we haven't decided any of that yet. So if you read things in the task force report, those are not our final decisions. And so please encourage people to kind of sit back a little bit, and I'm hoping that we can say that we've gone slow to go fast.
Thanks, Mary. You know, I think that that's a question that a lot of people have been anticipating and looking for, and I think that's a great call out. You know, in setting the stage and building this up, you know, as part of it is also having the tools, right? And these third-party organizations, and Millman is also going to be one of the other agents. I think that's a great call out for that as long as Penny wins. You know, I think that looking at the number crunching, the data, that's where a lot of us in this room are interested to hear more with that, right? But I think it's a great recognition that, you know, these are moving in with our respective committees. You know, getting a benefits package as a straw proposal from the plan and eligibility plan, and then it can go over to finance and revenue to kind of look at an actuarial analysis with that. So really appreciate you calling that out, because I know I've heard a ton of questions with regard to that as well. My next question, just to the group of you with respect on the subcommittees and all of that, is the beauty of this plan is that there's public input, that we are all in this room. The state of Oregon is building this plan. It's not a private insurer that's building this plan. How do you think is the most effective strategy for an advocacy group such as ours to provide the feedback that's necessary to shape this into what we want, but also not be burdensome, to be effective messengers? And I'm curious your thoughts on that from the three of you.
First. You want to start? Should we go
Sure,
this
yeah,
way?
always
We'll just go here. Okay.
This is something that I've been thinking about a lot, and our committee, I think, has talked about, and Collin being an advocate on the committee. And I think that it's what you all have been doing so far, like bringing people's attention to follow the work of the board, and some basics about that has been really helpful and great. I think once we have like our strategic communication plan, then I think that will be another time to kind of intersect and like figure out how you all can help support getting the word out and like the language that we're using and consistency in that. I made sure to, I'm blanking on the Bernie person. Robin. And like, I'm gonna connect with Robin and kind of find out more about your strategies around the communication piece that you're taking off with, so that I can have that in mind and think about that as our committee furthers its work. I guess I'll end with that.
I think one important principle of communicating with the general public is to emphasize a foreign idea up to this time, that what we are building, the Universal Health Plan, is belong to the people, everyone in Oregon. That means everyone in Oregon should have opportunity, if they so wish, to have input into the whole plan design. And not just at this time, even after the Universal Health Plan is implemented, the residents of Oregon will continue to input. So this is community-owned program. The Universal Health Plan does not belong to any single entity. It belongs to all Oregonians. And I think that's a very important part to emphasize in terms of communication. And Oregon did a pioneer work in 1988 to 89, when we implemented the OHP prioritized list, that the initial study using the cost utility analysis to prioritize those the condition treatment pair didn't make much sense. And so those pioneers, they initiated almost every county town hall meeting to listen to the public and using public input to adjust those prioritized lists And they done that for at least 2 iterations. And that is a pioneer work both in policy but also in academic, because it forever changed the academic world's thinking about priority setting. Up till that moment, the academic world's mindset of priority setting in healthcare is an engineering approach. It's all technical approach. But Oregon Health Plan's the priority processes reveal the truth. To set priority is not an objective science. It's a value judgment. And for value judgment, there's no expertise. In a democracy, anything that requires value judgment, the value has to come from the people. And so Oregon was the pioneer to reveal that truth. So after Oregon Health Plan, the academic world changed direction. Towards the end of 1990s, the academic world studying technology assessment, priority setting, started gradually, still very slow, but gradually to emphasize how can we solicit community value and preferences. So that is the one direction we are moving forward. So the public's value, public's preference matters for this plan, not just during this design phase, because keep in mind, even after we implemented the plan will continue to evolve, because nothing is set in stone, because health conditions, societal conditions, challenge will change, and the system will need to adapt to that change.
Well, I hope that everyone in this room knows that indeed every one of these meetings of the committees and the board are available to you. Google it, and Universal Health Plan Governance Board, and up it comes. It tells you when the next meetings are. You can give public input, either in writing or in person. And I think continuing to do that, I think that also Sandra Coiner needs to be pointed out. She has actually been listening to every one of these things, and that's a lot. And then summarizing a bit, okay? And then now Collin and Robin, and we're figuring out how to make that information in a succinct way available through HCAO so that people can know, and Sandra does a great job of synthesizing, a long meeting into a relatively short amount of time. And so then Collin, we're gonna have different people from the committees kind of read those or, say what's happening. So I think that's really important, and if you aren't plugged into that, please go look Universal Health Plan Governance Board and Oregon.gov, and it comes up and you can find out a lot of information. And many of you have been giving. Lou Siniger is well known. Well, Lou, thank you, you're here again. Okay. Tom Sinsick, oh great, Tom. So we have some regulars, but it's also nice to have some new people and some people who really have been affected by the system or have input. The other piece is, I've had a frustration, and I've heard it from some of you, about the budget and how much money do we need in order to really do this work right. And we're getting at that. There were some issues, and people like Bruce Goldberg and I and Amy are pushing for, okay, where are we at now? The end of this biennium, we get a chunk of money for these first 2 years, that ends on June 30th. Then we get, hopefully, if the Ways and Means Committee and everything gets going, we get the next chunk of money, which is in the budget, governor's budget, for $1.9 million. And how that is spent for staff, for consultants, all these pieces is what we're trying to figure out how much have we got left. But the last thing I want to say is that Kate Minogue on our board is not here, and she has been working along with Sandra and others to have community conversations around the state. And that's actually, we had the first one in Bend, and now there's others going. So how HCAO as the advocacy arm takes the information that comes out of here and goes out into those communities, and whether we have any money to help support that or not, those are questions, but we're asking them, okay? But we will, because I think that is what HCAO's action really will be, is to be out in those communities and to get that input and filter it back to the board.
Very good.
Thank you. We were intending to wrap our conference at 4 o'clock, so we only have 3 more minutes to speak to the governance board. I want to ask this question, and then my final question, although I have 40 that I wrote down, but I will get to my 40th question, which is, I think maybe only one of you needs to be brave enough to answer. I think there's a chance that the magnet effect, or whatever you want to call it, the idea of people moving to Oregon, even now, before we get the chance to vote, and perhaps after this is implemented, I think it's going to happen, and it's definitely going to be something we're all going to talk about, and maybe it's going to be a problem. What can we do? Yeah.
This was the same argument that came up when we started OHP,
Yes.
that all the poor people from the United States are going to move to Oregon and bankrupt us. It didn't happen.
Great.
I do not think it's going to happen.
Okay. Hell yeah, thank you. That's what Tony is going to head to Tony if you have any questions from the audience for our board in our final 2 minutes with them.
Yeah, please step up. I'll just say that I think more healthcare providers are going to come to the state because they're going to want
And we need them.
Have you had any industry groups approaching any of you yet, as far as?
Not yet. Not yet. They may be lurking out there, you know, and watching, but not yet. They're holding their powder.
You spoke briefly about the federal waivers, the issue of the federal waivers, and given that it's looking very unlikely that we're going to get federal legislation to deal with the waivers, if that doesn't happen, and I know you may not have all the answers, but how are you trying to design the plan? How are you planning to design the plan to try to avoid lawsuits against like the plan because they say, oh, this money cannot be used in this way? Do you have ideas of how to deal with that?
They're being discussed, and of course this new stuff, you know, since January has, you know, kind of been like thrown in the middle here. I don't think we have had the real deep discussions of, okay, what happens, but it's also an opportunity. I mean, some of those cuts and some of those things really won't happen for down the road, you know, a couple years. And so there's time. And I think that's to watch the political landscape, see what's happening, and you know, it's, as Dickens said, it's the best of times and the worst of times.
I would just add, I would add to watch the operations committee. That's where the waiver conversations are happening, and they're in lockstep with the folks with OHA and Medicaid. And our current Medicaid waiver goes through 2027. So just so folks know that. That's when that
we
is.
hope. Yes. Trump could turn it up.
Yes, he could.
Are we still on track? And this is disregarding Medicare problems right now. I mean, the Medicaid problems.
Yeah.
Are we still on track to at least be optimistic that healthcare will not cost people who pay for plans right now any more than they're paying now?
That's our plan.
That's the goal.
That's the goal.
Goal,
And trying to figure out, that's where people are saying, well, how much, you know, how much is this going to be to me? And one of the things that Echo Northwest said at our last meeting that was hopeful is they say it's not going to be too hard to develop a calculator. And so that's a really, I mean, I think it's a tremendously hard problem, but they didn't think it was that hard. So I think fairly soon we will then be getting, but we have to know what the benefits, I mean, there's, you know, all these pieces.
A public-facing calculator, right?
But we will have that.
Just a note, California has a calculator for theirs.
Okay.
It's not as specific, but it have pieces that I think that they could build better as an actuary.
Okay.
Yeah, my biggest fear is that with this, all this privatization going on, acquisition of medical practices, acquisition of hospitals by insurance companies who already own Congress, so it's unlikely to stop. that this is going to end up being so expensive because they can basically demand whatever they want. So can you assuage my fears, please?
HCMO in Oregon, we have a law that anytime any of these mergers, sales, acquisitions, that it has to go through a process. And look at the Care Oregon scan, didn't make it. Look at Legacy OHSU, didn't make it. So some things, and the corporatization of CPOM, I think that we have better guardrails than some places do. And most of our stuff in Oregon is nonprofit health systems. We have some for-profits and medical clinics, et cetera, but at least the hospital systems are mostly in Oregon nonprofits. So, but I think our process with the HCMO, frustrating as it is, it has worked, I think. I don't know.
I feel like I'm adding color commentary. I have a lot to add on this, but I don't jump in.
Yes.
But yes, I mean, I think that, yeah, we have put into place some specific legislation with regard to the healthcare market oversight. And then recently with Senate Bill 951, which all of you were helpful in participating and advocating for setting that up. That's a big success. And it's setting the stage for a thorough review to look to say the merits of a merger or an acquisition take place. Now I would say after we've had some big mergers that have been under review, you have a lot of private equity and you have a lot of organizations that are taking a second look of why do I want to come to Oregon, and I have to go through that process. So I think in that we're making big changes with that.
This maybe seems propitious, but I heard one little thing that caused me to want to ask, and I may have misinterpreted because of the background chatter. It's hard to hear at times. But what I heard was that we're going to try to recapture the revenue that's currently coming from employer-paid insurance. And my caution would just be, let's not repeat the mistakes of employer-paid insurance. If you want to extract that revenue from employers, do it by taxation or something.
That's what we were
connect it to employment, because then you get the employment penalty if you get laid off.
That's what they were talking, payroll tax. Tax.
I think we got time for one more question, and then we gotta wrap up.
You mentioned quite a few of the hospitals in Oregon, vast majority are nonprofits. And my understanding is up until a certain point in time, if a hospital is a nonprofit, they had to provide charity care to the people who couldn't pay it. But I understand that somebody did something to say, well, you're a nonprofit if there's benefits to the community, which is hard to quantify, demonstrate, so forth and so on. So is the committee, or the universal, is the governance board, I should say, looking at the definition of nonprofit and what it really means to be a nonprofit healthcare provider?
I guess what I would say on this one is that we are looking, the Finance and Revenue Committee, the last meeting, Charlie would know, and John Santa and others, that trying to figure out how do we get, most of these nonprofit hospitals have big investments and what do you call them, endowments, okay? And so when this all happens, how do we capture that money? How do we, just so they don't walk away? And are there ways to get that money? And so there's a lot of looking at not letting the nonprofit hospitals walk away from their responsibilities.
Thank you, Mary Lou. Can you guys give a round of applause for Amy Fellows, Dr. Collin, and Mary Hennrich, members of the Universal Health Plan Governance Board? Thank you so much all for coming and spending time with us today.
This, because I feel like a lot of you already do know HCAO, but you might not know the new HCAO because there's a lot going on. So I'm going to whip through this, and then we're going to do the raffle pull, and then we're going to do some thank yous, and we're going to get out of here. So really quick, some of our new volunteers like Jackie and Evan and Jonas Tabinski, they came up with this new HCAO 101. So I want you all to know, some of you long-timers that have been in the HCAO movement, universal healthcare movement for a long time, you all just kind of got thrown into it. You came to a thing and you kept showing up and you started wearing a red t-shirt. Next thing you know, you're a long-time HCAO person. But now there is a whole, like, if you ever started a job and you had to go to orientation the first day, we've got orientation. So when people sign up to get involved with Healthcare for All Oregon, they now get this great HCAO 101 slide deck. So we kind of talk about why it doesn't work. We talk about how our goals are three-pronged: building awareness and support. We're creating and growing our resources, adding more people and sometimes funds like today to the fight. And then influencing legislation that moves us farther and closer to a universal healthcare model. Now this is one slide I want to pause on. This is one of the ones I did want to show. Because when we're talking about this, someone said, it'd be really good for people to know like what HCAO structure is like and what is HCAO. So essentially, from a structural standpoint, we have our board, right? So you've met some board members here. We've got 17 people on the board. You selected a bunch of them today. We try to be geographically diverse, bring unique perspectives from our careers and lived experience. We meet monthly on the second Saturday. If you would like to come and watch a board meeting, they're all on Zoom. If you have no better way to spend your Saturday, if you email me at president@hco.org and I will send you an invite. Now, John Rickert in Yamhill was like, I'd like to come and see a board meeting. So we're like, do we have a problem with that? No, we don't have a problem with that. Now, if you come to a board meeting, you can check it out and watch, but you're not like talking a whole lot. We do like a public comment like the electeds do at the beginning, so you can have your 2 minutes. But then you're kind of just there on mute for the rest of it. And if you want to hang out, more power to you. So we got nothing to hide. But anyway, so second Saturday is typically at 10 a.m. We did cancel the one on this coming Saturday because we're here today. No Kings events, et cetera, et cetera. It's our Army's birthday. Cool. Okay. And then we set strategic direction. We have fiduciary responsibility to make sure that we're managing the resources and moving the work forward. And one thing I wanted to say on this is, where's Charlie? Charlie Swanson. Charlie. There he is. See this guy back here, Charlie Swanson? Not only is he the guy to talk to on PBMs, which I plugged him earlier, but Charlie and Sandra and Mark also serve on HCAO Action. So we at HCAO, Healthcare for Oregon, we're a 501c3, which means, we can get the tax deductible benefits and stuff. But we can only do like yay much political lobbying and influence and all this kind of stuff. But we have our sibling, Healthcare for Oregon Action, and they are a 501c4, so they can do things like nominate candidates and take out political messaging and all that kind of political stuff that gets our little 501c3 hand slapped. And Charlie, I think you said earlier today, I don't know if you want to come up, but you have a political action fund called like One Payer Fund or something like that, but I'll let you say it. But what we're looking for here is I just want to do a quick plug. If anyone wants to get involved on the political side where things get real spicy, Charlie's looking for a partner.
So what I really want to talk about is Oregon Single Payer Advocates, which is a PAC. And we're going to have a pretty important election coming up in 2026. Those are going to be the legislators who will be looking at the plan that comes from the Universal Health Plan Governance Board. And so we would like to have a bunch of good legislators in there. If anybody is interested in helping with that or taking the lead on that, actually it'd be even better. We actually do have a PAC that is already set up, ready to do that, but it needs some help to be effective. And so I would love it if anybody who is interested at all in getting involved in that sort of political activity, contact me. And let's see.
What's the best way to contact you?
Probably email. So cswanee, that's CSWANEE @msn.com. So you can contact me there. And you can also just contact Valdez and he can contact me. Yeah. So that I think is going to be a really important activity, and there could be a lot of action on that if there were people wanting to do that. So I'll stop there.
What kind of help? Like, scalable? What do you want?
Yeah. Well, the main help we would need is somebody who is willing to sort of take the lead and say, yeah, let's do something on this. Let's contact candidates. Let's help get the right candidates coming forward to run. Let's help get those candidates elected. And there's a whole variety of things in there. Right now, we have a website, and we've done a little bit, a logo, but we have not done very much just because we don't have the capacity. And we need more people who are willing to help with that, so. In any way you want.
Real quick, because
Could that person utilize chapters to help vet candidates?
So the chapters can help in some manner, but they can't do a whole lot because the HCAO and the HCAO chapters are C3. They can't be involved in electing candidates. But they could get people connected with yeah. Okay. Yes.
All right, well, if you have questions about it, definitely hit me up. I can help share any more information, but it is an awesome thing. It's like that scene in Karate Kid where Mr. Miyagi gives that beautiful yellow car to Daniel, and he can just has the keys, and he can drive it wherever he wants. You've got a pack just ready to go. So if you want to get in that car with Charlie, let him know. Okay, all right. Committees. Okay, so then we have these committees that are moving the workforce. We get the board, and just like the governance board, we have our own board and we have our own committees. So we've got nominations and elections, communications, legislative, mobilization, fundraising, and membership. And we have that, and usually those are chaired by at least one, like a board member, and we divided that up. We have our staff. Staff's job is supporting the chapters, paying the bills, managing that database that we've been talking about off and on today, getting supplies and printing, which, as a quick remark, chapters, if you don't have all your bundles of supplies, printing, checkouts, buttons, stickers, and all that stuff, see Linda's table back there and take it with you because we brought enough for you so you can take it back to your respective area of Oregon. But they also help with external relations, communications, and then supporting the board. And then we have our chapters. In the chapter role, organizing on the ground, creating more social connection. That's something we're trying to emphasize more. You know, it's not always about the work, just coming together, building bonds, so it's easier to do the work when you do it. Having community conversations, and again, Sandra Coiner and others created this great packet. It's a talking point slide deck you can tailor to your audience. I recently was at a neighborhood association in North Salem last week. Went really great. Now they're inviting us back to their summer event. But mobilizing at events, legislative relationships, engaging local government, and growing the movement. That's what it's all about. That's what Michael's call to action was, grow the movement. It's like compound interest, you know, like the more we do now, the easier our job will be in 2 years. Okay, next up. And I'll just kind of zoom through this. Okay, that's more for the HCAO 101 folks, you know, when they're kind of learning about like how we pay the most and our healthcare outcomes are not the best. And then we talk about universal healthcare. We tell them about Measure 111 and the Hope Amendment and what that did. We talk about our plan. We're just marching this football down the field with first was the task force, now the Hope Amendment, now the governance board, and then pretty soon it'll be end zone, you know, universal healthcare. All right? Yeah, you are here, okay? And this is a call to action. I think you heard it from Amy and Mary Lou and Dr. Chi. We are asking everyone to come, get involved with those governance board meetings, come in, provide testimony, show up, even if you do it every time like Lou and they recognize you now. And then, again, where we're going, all of this is prologue to September 2026 and reading those recommendations that are going to come out of the governance board. And then that governance board, we're going to ask our legislative friends to refer that to the voters because they have the power to just take that plan, and we have a short session coming up after that. They could refer it to us and we could be voting on it as soon as November of 28. So that's where we're going next. Opposition's always going to say, but you're going to pay way more in taxes, and big government is overstepping its bounds, and the outcome is uncertain. This has never been done in America before. So they're going to try to scare Oregonians, but we're going to respond between now and then. We're not waiting for this day to happen. We're starting today. We've been doing this for years. We're going to be like combating that with combating the misinformation with an upstream prevention approach of explaining the problem and why this would be a good thing, and why we're the only country not doing it. And so we support the work of the UHPGB, the governance board. We're engaging in community. Some of the conversations we had today will help us do that even better. Okay, next slide. So, where do you fit in? Now, some of you are very much like plugged in. You are like plugged in. I can't imagine you more plugged in. But if you are not, and you're thinking, you know what, maybe now's the time. You know, I've been like, I came to the meeting last year and I like what they're doing, and I'll come next year. But maybe you want to come and get more involved now. So I would say you can email volunteer@hco.org. you will get an invite to score a ticket to one of Jackie and Evan's HCAO 101 classes. And then at the end of that class, after you go through it a lot slower than I'm going today, at the end, you will be, they'll try to put you to work. So Dr. April Milan, she's a physical therapist up in Portland. I saw a couple weekends ago. She's like, she saw me at a non-HCAO thing. She's like, hey, I went to your HCAO 101 this morning. That was pretty cool. And I'm like, oh yeah, that's new. Yeah, is it good? You like it? She's like, yeah, I'm working a farmer's market tomorrow. I was like, awesome. So they're definitely going to apprise you of things going on in your neck of the woods that you can get involved with. So please visit the website. And you can canvas, you can go do the farmers markets, you can wave signs to Timbers games, you can host a social event, you can send in your horror story about for-profit healthcare, you can testify related to gender affirming care, disabilities, whatever matters to you, whatever you have experience in. Help us with social media, data entry, like whenever we do all these events and have all these lists. Yeah. Ooh, houseplants. Awesome. See, I told you this movement was growing, right? Yeah, Evan.
The request is if you're good at growing houseplants, grow us a very nice houseplant to use as a prize later this year.
Okay, grow a nice houseplant. Yes, it is legal in Oregon. Okay, here we go. All right, all kinds of plants. Okay, but we also do follow-up phone calls. The Milwaukee Action Group is forming up. Writing skills. If the gift of the written letter, or it's writing grants, or writing letters to the editor, or newsletter articles, let us know. Again, all you gotta do is email volunteer@hco.org and they will cast you into a role. But really takes all of us, and if you can bring, like Tony said, 5 people into the movement, we would love for you to do that. All right, I think that's my slide. Is that it? Oh, big upcoming events. Okay, so June 14th, next Saturday, we got Flag Day, the 50501 rally. It's gonna be at 10:30 a.m. Southwest 3rd Avenue, Stumptown Roasters. So this is on our website. Mary Lou's going to have a table there. And the thing is, now this is the cool thing. We wanted this for years, but now we have it. If you go to HCAO.org and you click on events, there's a calendar view. You got a little calendar. You can just scan, okay, what day do I have free? Okay, June 14th. Oh, looks like there's this 50501. What's that? And so you have all the things, and then you can sign up for it, and it will add itself to your calendar, send you little text invites, all this stuff. Salem. Oh, wait, we'll go back one. Salem, we've got a fun run coming up on August 17th. So fun run, Salem, Jennifer Sprague, Bill Dalton, Rose Hope in the house. So we're gonna have a fun run, and even if you don't want to run, you want to jog or walk or roll, whatever, all are welcome. So August 17th, so I'm really excited. I'm signed up. Anyone else signed up already for the fun run? Yeah, Jennifer, huh? All right. And walk. Yeah, walk, roll, jog, sashay, strut, whatever. Okay. And then last but not least, we have our garden party. Remember I said there's like 4 big fundraising things we do here? And 2 of those are mailers. So in terms of in-person events, we're September 20th. This one's a special one. This is fun. This is cool. September 20th, 2 p.m. to 5 p.m. It's the beautiful Bella Madrona Gardens there in Sherwood. And we're going to have raffle prizes. The Homebrew Band, which is like a bunch of awesome docs that are down through Universal Healthcare that's, slap the bass and play some guitar. And then, and there's like, some wine and beer and all that fun stuff. And inspiring speakers, and it's just a nice day in the garden. So this one's more like a program and like health and policy and stuff. That one is inspiring speakers, but it's also just like coming together in that social connection, and it's a really good time. So mark your calendars now, September 20th in Sherwood. And who is it I was talking to? Somebody, if you have art or crafts or like things that you do that you could donate to the cause, we would love to take those and make it a prize that's worth bidding on. Okay. And then local chapters. We have chapters right now in Portland. Jackie Naganua. Where's Jackie back there? Hey, Jackie. Clackamas County. I think Karen's on Zoom, but where's Gary? Gary Sinnen, her vice president. The vice over there at Clackamas. Lynn County. Where's Rick Stagenborg? Lynn County right over here. Lane County. Of course, everyone knows Lane County Lou by this time. They should call it Lou County. Central Oregon, Nick Campbell, where you at? Nick Campbell over here. Union County, it's not Shoal Campbell anymore. I think they're in transition, so we got to update that slide, but they're still a very much active county. Mark Weiss, where's Benton County? NVHCA, where's Mark? Mark Weiss. Oh, Mark has left the building, but Fritz is also one of the key leaders over there. Marion Pope, you got Rose and Bill. Hey, right back here, huh? Bill Dalton. Yamhill County, Liz Marlia Stein. I don't think Liz is here today. I think she had a conflict, but she's in Yamhill. Rogue Valley, Lori Hoagland. Lori Hoagland right here. And Tillamook County, Bruce Deloria. So we're going to be adding more chapters to that list. Classic County, Deschutes, Coos, not Deschutes, Douglas. So please, also, last but not least, we now have a Discord. If any of you have never heard of Discord, basically what it is, it's like an online platform community thing where I think they used to use it for like video games where you're like, shooting each other and you're talking smack. I don't know what it is, but basically it's more than a video gamers thing. It's a community space, right? And so we have this Discord. You can get in there, and there's people that are tuning into this meeting. Hey Zoomers, if you're still there with us, thanks for hanging in and finding the link to Discord. But anyway, so Discord, and that's another great place to keep up with. And each county chapter has its own little channel, so you can have little mini communities online. Save the email. Okay, is that it? One more. All right, so see you at the garden party. And don't leave yet, because we got the raffle tickets. But thanks again to our sponsors, the First United Methodist Church, Ocean, ONA, Oakshire Brewing, and Project Access Now. Give it up for our sponsors.
And thank the kitchen.
I'm going to do that last, Lou. All right, okay. All right, get out your raffle tickets. I probably should have done this a little bit ago, so I might have to do a couple of polls because maybe someone's left or something. All right, ready? Okay. This raffle ticket is for an Oakshire Brewing t-shirt, 4-pack, and tote bag? Oh, gift certificate. Okay. And they're down here in just south of us. Okay, ready? 430-494. Anyone? 430-494. This might be. Keep drawing. Like Bob Ross. Keep drawing. Okay, here we go. 429-949. Was that close? 429-949. Still going. All right, let me go deep in the pile here. All right, 429-948. Hey, Adriana! All right. Tell her what she's won, Bob. All right, where is Adriana's prize? What did we do with that? The Oakshire stuff. Oh, right here. So come on up, Adriana. Oh, it is still cold. All right. You have a 4-pack of amber ale. Are you an amber ale person? You're like, ale? No. Okay, and then a t-shirt. So anyway, Adrian, why don't you introduce yourself? This is your first time meeting. How do you hear about this and how are you feeling at the end of this fine day?
I heard about this a long time ago, but most recently got involved because I heard about the governance board, and I was like, oh, I need to go. I'm an acupuncturist, and we tend to be underrepresented in such places, so. And yet we save people a lot of money. So, an acupuncturist in Portland, and then I realized that this organization was really behind a lot of that. So I figured I would get involved, and I have more time recently. So here I am. And thank you everybody for everything you're doing, and thank you for this awesome gift.
All right, give it up for Adriana, an acupuncturist. An acupuncturist was my lifesaver in my teen years of my growing pains. And then my wife used it to induce labor. True story. Pitocin. No, acupuncture works. Trust me. Talk to you later. Okay. All right. So I wanted to thank the following people for donating food for our awesome food we had today. I ate really well today. Did you all eat pretty good? Was that good? That's some good food. We had Entman's on ROE Foods for donating some of those little snackies. Nancy's Yogurt for donating yogurt. We tried to be a very cultured organization, so we had to have yogurt. Market of Choice, Willamette 29th location. Thank you, Market of Choice. Voodoo Donuts, also thank you to Voodoo Donuts for donating donuts. Whole Health. Okay, and I want to thank the kitchen crew because while we were in here having all this fun, there was a bunch of people early this morning setting up, making sure you all had stuff ready, and then lunch. So Kevin Jeffrey, Karen Covino, Kathy Phillip, Radel Perez Chica, still rocking, you rock. Wendy Shaw, Kathy Henson, Penny, is it Penny Moblo? Moblo? And, all right, Penny, thank you, Penny. And also thank you to Chico Schwal for playing music before and doing lunch. So here's Chico. All right, everybody, well, that is it. That is the 2025 HCAO conference. If you got to get going, totally cool. If you can stick around and help us with some tables and chairs, if you're able to do that kind of thing, we're going to be doing that for the next little bit, and I'll lead that effort because Lou and Jack told me how he wants the room put back together. So thank you all very much, and safe travels home.